VG8 Radio.
Batch 10 on November 6.
Someone out there needs to hear my voice.
The Certified Voice Artist Program Batch 10 starts on November 6, 2021. It will run for 4 consecutive Saturdays from 9 a.m. to 4 p.m. and an additional Saturday will be allotted for the virtual graduation.
I am a CVA, Certified Voice Artist.
Learn more beyond the art of voice acting through the program. Held by the voice master Pocholo de Leon Gonzalez and other CVAP graduates who are now thriving in the industry. CVAP is 50% off. From 10,000 pesos, the workshop is now priced at 5,000. The workshop is purely held online via Zoom. Scholarships are also available. Visit www.certifiedvoiceartist.com to learn more about CVAP and to register.
Because I believe that someone out there needs to hear my voice.
I go to work, I use my Trident Gold mouthwash. Ginagamit ko to kasi mabisang pagpuksa ng unang bakterya. Subukan ninyo.
Morning. I'm Dr. Joseph Lee. Every morning I hydrate myself with natural soft spring water from Turkey. It is a soft water with low sodium and enriched with ozone. Eric Lee. I love my coffee.
VG8 Radio. 9, 8, 7, VG8 6, 5, 4, VG8 Radio. 2, 1, VG8 Radio, the voices of greatness.
This is the Sunday Health Show.
Powered by VG8 Radio.
Okay. Great day, everyone. Welcome back to show Kung Saan Health is Wealth, the Sunday Health Show. I am Mitzie Aguinaldo, the voice royalty. So before we start, we'd like to give thanks for the support of Genesis Organic Spirulina, Eric Lee Natural Spring Water, Trilodent Gold, Salvicare Coffee, Regine Tolentino Atelier, Asian Hyperbaric Healthcare Institute, and Emergency Rapid Assistance app. We are currently live at the VG8 Radio Facebook page, the Sunday Health Show Facebook page, and VG8 Radio YouTube channel right now. Good morning po! Isang magandang umaga po sa inyong lahat. It's another Sunday yet again to share a new set of health information to our beloved viewers. So welcome to the 5th episode of the Sunday Health Show. Sunday na ho ulit, mga ka-Sunday Health. Pwedeng rest day, pwede ring work day, lalo na sa mga may trabaho pa rin ngayong araw. Kaya sa mga nasa trabaho po nila ngayon, mga medical frontliners o kahit corporate workers na naka-work from home, linggong-linggo, saludo po kami sa inyo. And let's not forget to be grateful with the job we have right now kasi hindi lahat nagkaka-opportunity na magkaroon ng trabaho at experience na binibigay po sa atin. And of course, magpasalamat din sa blessings na binibigay ni Lord. Amen? Amen po ba? Yan, magpasalamat po tayo. Ayan, kasabay po ng ating pagsaludo, gawin po natin ang ating parte na maging maingat pa rin sa ating galaw at panatiliin ang healthy mind, heart, body, and of course, soul. Okay, so before we introduce our segments for today, alam nyo ho, this week, someone very special to us had his birthday. And of course, walang iba kundi ang ating producer, main host. Okay. Yan, nakita na natin siya. Main host, Kuya Doc ng Bayan, multi-awarded celebrity urologist, Dr. Joseph Lee. Ayan, batiin na po natin. Babatay na rin po siya sa inyo. Okay?
Great Sunday morning. Of course, indeed. Tama nga sinabi mo, Mitzie. It's always nice to watch the Sunday Health Show before you have your lunch, okay? We always have interesting topics and interesting resource person or guests in order to titillate you every Sunday before you have your lunch, of course. today is the second Sunday. I think the second Sunday of November, of course. Malapit na lang. Ilan days na lang before Christmas. Oo. At pulang-pula tayo, hindi pa Pasko. Okay. And of course, we always have very interesting segments for you to take in footnotes or to remind you of that health is about being well and being of good lifestyle. Okay, tama ba yan, Mitzie? And of course, we have to bring in the rest of our hosts, si Freddie and Jihan. Oo, nagtatago kayo. Ano ba ang binabalak ninyo? Bakit pulang-pula tayo?
Okay.
May
So-
kakanta ba?
Ay, nako, Dok. Di na
Ano?
ako magsasalita. Lagi mo na lang kasi ako nahuhuli. So, okay. Before we start our segments, okay, chill lang muna po tayo at meron po tayong mga ipapakita muna kay Doc. So, sit back,
Ano
relax
yun?
muna po. Hindi ko na sasabihin, Doc.
Okay.
Ayan
I
na.
should shut
Okay.
up. I should shut up. Okay.
Okay.
What's up, John?
Let's get it straight, Doc Joseph. Parang kinabahan ako.
Disclaimer lang ha. Ako po ay isang urologist. So,
For Best Morning Show Hosts goes to Daniel Razon, Dr. Joseph Lee,
Sana masagot ninyo po ako. Siyempre, sasagutin ko kayo. Nga, ano to? Totoo po bang nabasa? Ano to? Ang mga tanong nyo patungkol sa kailangan humanap tayo ng isang prophylactic oral.
Good morning from a beautiful morning or
Oh my
autumn
gosh.
morning here in Illinois, USA. This is Jojo Sison, president and founder of Project Michelangelo Foundation and co-investigator research scientist for the U.S. space program working with astronauts. But anyway, the reason why I'm making this video is I was asked to greet a very special someone, Doc Joseph. Happy birthday. I know it's another year for you and many people ask you for favors all the time and wish you to count your blessings. But I'm here to add on to the blessings that you have. I want to thank you for all the good job and your enthusiasm for life and your radio talk show program. And I just want to give you a message for your birthday. The message is that the wisdom I learned from receiving awards and being greeted happy birthdays for almost 6 decades of my life is that whenever God gives you an award, it is never to make someone greater, but to make that someone lesser. Because in our humility, will God give us more blessings? And the blessings we'll find out that it is not really for our sake, but for the sake of others. And I think you're doing a great job of that and doing your God-given talents for a good purpose and educating people. So from the bottom of my heart, from a fellow doc to another, and also, most importantly, a fellow Tomasian, I bid you a happy birthday on this beautiful autumn morning here in Illinois. So I bless you in the name of the Father, the Son, and the Holy Spirit. Happy birthday, Joseph. Bye-bye.
Hi, Doc Joseph. Happy
Oh my
birthday. first and foremost, I wish you the best, and I also wish that this year will be a blessing to you, and may your heart's desires be granted. Thank you so much for being a good friend, and also, miss na kita, sana maka-wine night na tayo. O gusto mo wine day pa? Gusto mo? Ingat ka and see you right after this pandemic. May right after ba? Or siguro once we have adapted to the new normal. Mahal na mahal ka namin. And see you
How did you get
soon!
there
Happy
now?
birthday!
Hello, Dr. Joseph Lee. This is Dr. Dex Makalintal. Idol, marami pang birthdays to come. At sana ay naging nasa mabuti kang kalusugan. Ingat lagi.
Idol mo to.
Happy birthday, Dr. Joseph Lee, from Marina and Hyperbaric family.
Dr. J, Dr. Joseph Lee, Dr. JL, my Lodi, saludo ako. Alam ko na marami ang gustong bumati. Isa ako doon sa gustong batiin ang magaling na urologist, one of the best urologists in the Philippines and in the world. I know that, kaya celebrate life with blast, no? Celebrate life with a gift dahil ang dami-daming nagmamahal sa iyo. Sana nga ay kahit konti maambunan ako ng mga commercial mo, no? Dahil napaka-bless mo, no? At today, I wish that you have more blessing to come, opportunities to serve people, no? At tuloy mo lang yung iyong advocacy through social media ay nagagamit mo ang iyong pagka-doktor. And I hope na humaba pa ang numero ng iyong pera at ng iyong edad, no? Kaya God bless, and may you have more life in your years, no? Dr. Joseph Lee, JL, God bless.
Brother Joseph Lee, aking idol, pagiging Doctor of the Stars, isang maligayang karawan sa'yo. Matagal na kitang hinihintay dito sa klinik ko. Sana magkita tayo ulit. Again, enjoy your day. Happy birthday, brother. Heart, heart.
Hi, Doc Joseph. I want to greet you a very happy birthday. It was nice to see you a little while ago. I hope we get to spend more time together soon and enjoy your special day.
Together with the humanitarian workers of Jojo Saison's Project Michelangelo Foundation, Northern Mindanao, we would like to greet Dr. Joseph Lee a happy birthday. May the Lord bless you and keep you. May the Lord's face shine upon you and be gracious to you. May the Lord lift up His countenance upon you and give you peace. Happy birthday po.
Hi, si Doc. Dahil matagal-tagal na rin namin siyang nakakasama sa UNTV, nakita ko sa kanya na yung public service, pagtulong sa kapwa is part of his life na. And anyway, na pwede siya makatulong o may magagawa, hindi siya humihindi. He's a very diplomatic person. Kung may nagawa ka o kasino man sa kanya na hindi niya nagustuhan, hindi kanya pagsasabihan ng masasakit o mabibigat na salita. I-approach ka niya o pagsasabihan ka niya in a very nice way. Alam niyo ba na hindi naman pagiging urologist talaga ang gusto niya noong una. Gusto niya talaga naging veterinarian. Accidentally, kaya niya naging vlogger kasi minsan nilapitan ko yan dahil kailangan ko ng content sa isang show na hawak ko dati. And-approach ko sabi ko sa kanya, look, pwede mag-video tayo. Kailangan kasi ng content creator Walang refusal yan kung kaya lang din naman niya. Doon nagsimula ang journey niya bilang isang vlogger. Pero yung vlog niya very informative naman at worthy ang content. Kaya din siguro iilan pa lang ang subscriber niya dahil hindi naman balahura ang content niya. May secret si Doc alam niyo ba? Nagbe-birthday naman yan taon-taon. Pero yung mga kasabay niya, nagsitandaan na. Pero siya, kitang-kita niya, very young at fresh pa din. Ayaw niya kasi ng mga negative vibes. Ayaw niya ng mga bagay na nakaka-stress. Kaya kita niya naman sa itsura niya. Geriatric age na pero pediatric look pa din. Wish? Wala naman ako ma-wish kasi sa kanya naman na yata natin. Pero babatiin ko naman siya. Happy birthday, Doc.
Hello, Parsi, Doc Joseph. Thank you so much for being an awesome friend, ninong, kumpare, and doctor, of course. And you're such a great public figure and idol ng marami. Thank you for being a blessing in our lives and in so many other people's lives. I just wish you good health, and many, many more years of helping people and just doing what you love. You're so passionate about what you do. You have so much knowledge, and you're so generous in sharing your time and wisdom with others. I admire you so much, and I just wish nothing but the best for you. Take care always, Parsi. Stay safe, and cheers to many more awesome years ahead. Love you so much, and I'll see you very soon.
Yeah, love
Great
you,
day,
Mark.
great day. I would like to wish Dr. Joseph Lee of Sunday Health Show a wonderful and a happy birthday. I hope you receive many, many blessings for your show and for your birthday. Sana po ay you stay young and fit at 21, Doc Joseph, and hopefully I will see you very, very soon. This is Richard Avalos of VG8 Radio. Thank you so much and have a happy birthday, Doc Joseph. Stay safe.
Hello, great day and happy birthday, Doc Joseph Lee. Doc, first of all, I would like to say thank you very much for being one of my best friend and being one of the host ng Quarant Talk. And also, syempre, ang yung napakagandang programa, a Sunday Health Show with Doc Joseph Lee. Alam mo, napakarami nyo nang natulungan. Alam ko, marami na ako, kumbaga, hindi ko man sila kilala. And they're so thankful sa'yo. Kahit yung mga nakakapanood sa'yo sa YouTube, iba't ibang mga palabas, sa iba't ibang channel. And everyone are so thankful sa'yo dahil sa pagiging generous mo. And I'm so happy to have a best friend like you. Alam mo, isa sa pinagpapasalamat ko sa'yo is yung panahon na ako ay nagka-COVID, no? Ikaw ang talagang sumuporta sa akin, ikaw yung lagi ko natatawagan, ikaw yung nag-guide sa akin. And I thank you for that. Utang ko sa'yo ang buhay ko, literally. And yun lang, gusto kong sabihin, thank you. Manatili kang bata, batang itsura, bata ang puso. Pero ang higit sa lahat, mabuti ang kalooban. Alam mo yan, marami ka nang pinagdaanan, Doc, pero andito pa rin kami para sa'yo. Mahal na mahal ka namin, and tandaan mo, ikaw ang best doctor in the world. We love you, Doc.
Love
happy
you
birthday.
too.
Mahal na mahal ka namin, and happy 25th birthday. See you soon, ha?
25th,
Kakain ba tayo sa
21,
Poppies?
25th na.
Enjoy your day, Doc.
Our favorite place, Poppies. Ay, wala na. Buti na.
Yes, Doc. Happy birthday
Oy,
sa ating ng Doc Lee. Thank you po sa pag-share ng inyong valuable insights and expertise dito sa Sunday Health Show. Talaga naman, kita nyo naman kung gaano tayo nililinlang ng panahon, di ba? Dahil meron po yan.
Nililing lang talaga.
Si Doc Lee, dahil 32 na siya ngayon, pero mukha pa rin siyang 31. Joke lang, Doc. Happy birthday.
Thank you. Kailangan apat ang frame natin para nakikita ko kayo. Ano lililing lang? May 21, may 30 pa. Nako, baka maniwala ang ating mga audio. Pero I do not know. Thank you, Team Mitzie. Sino pinagtatawagan yung mga numerong yan?
Magic yan, Doc. Magic yan.
Lalo na si Chin. Nako, mahirap anuhin yun, si Chin. Si Jojo. Oh my God. Magic ba? Ikaw ba nag-connect, Freddie?
Hindi po ako. Ang atin pong, ang salarin po dyan, walang iba kundi ating director.
Oo, kaya pala hindi siya inik-inik sa akin, baka mahuli ko. Pero thank you, and
May
of
message
course,
pa, Doc. Hindi pa
tapos.
tapos.
Yes.
Hindi pa tapos? Kasi hindi niyo ako pinipigilan, I told you.
Masaya lang kami, Doc, na masaya ka rin ngayon. We're very...
So wala muna segment, ito muna, di ba?
Opo, yes. Para sa inyo talaga, Doc, yung linggong to.
Okay.
Yes, greetings po from Kuwait. And of course, ito po ay isang napakagandang pagkakataon para pasalamatan po kayo sa inyong kaarawan. At ito nga po yung nagbigay sa akin ng opportunity na makilala ang one of the best doctors, sabi nga, around the world, not only in the Philippines. And I do believe.
I believe.
Isa lang po masasabi ko, Doctor, ang galing-galing mo talaga, and I really love being part of the show, and alam ko marami ka natulungan mga tao na matagal ko na narinig ang pangalan mo for long years. Akala mo ngayon lang tayo nagkita, but I've heard all your names. I mean your names, not years back.
Na ba?
Happy birthday once again, the Doctor.
Thank you, Freddie. I'm so proud.
Yeah, more blessings.
Yes. Ano pa?
Happy birthday, Doc Joseph!
Happy birthday. Yung ating
Ayun.
director na pinakabata, pinakamaganda, maganda. Bakit? May mangyayari pa? Tapos na.
Greet lang kita, Doc. Happy
Okay.
birthday. Doc Joseph, I'm very thankful and glad na I became part of the show na nung una, tayo pa lang nila Ate Janine up until dumami na
Yeah.
tayo ngayon and lumago, dumami na yung supporters and that's all because of you din, your trust, and yung generosity mo nga. Lahat ng tao kanina, Doc, they are all saying how generous you are. And I'm really happy na mentor na rin kita, Doc. May mga, alam mo na, may mga nasi-share tayo, mga pinagdadaanan.
Yes.
Yeah. And I'm very happy na isa ka din sa mga taong na natatakbuhan ko para tanungan ng advice. And thank you po kasi napakabait niyo, Doc. Yun. We love you, Doc. Marami hong nagmamahal sa inyo, Doc. Andito kami. Whatever happens, we're here to support you and we're so proud of all your achievements. Happy birthday, Doc.
Yeah, I realized that Generation Z like you, or of course you per se, individually, you're so patient in my mood. Sometimes may mood ako Alam mo, Jihan, may mood ako, alam ni Mitzie yan Pero wala lang. Alam mo, Freddie, ano lang siya, parang dire-diretso lang. Para sa akin, itong batang ito, hindi ako sinusundan, alam mo. Pag umakyat ang wave ko, wala lang, ganyan lang siya. Sabi mo, ganyan siguro. Ako kasi, pag inano mo ko, sundan kita, mag-ano. Siya, ganun lang. Yeah, alam mo, I'm very patient, sabi kong ganyan. So, you have to forgive me if I have sometimes may mood, alam mo, senior, sabi nga na isa, geriatric, sa geriatric, at least yung mga lang naman yung sa tingin ko, yung mga a little of what I say. I want all of you to be very good, and I'm very happy. Kasi medyo rin ako, discipline. Gets mo? On time. I'm very time conscious. You have to know that I am very time conscious. Kasi ang aking, you have to know na when we do work, gawin natin. Kung ayaw natin, we move on and we leave things. So parang, di ba, alam mo yan, Mitzie? Kung ayaw mo, di wag. Diretso tayo. Kung ayaw nila, but I will do it. Kunyari, if ever somebody that you like when you're doing something, pag iniwang ka na ng mga mo, alam mo, other things and beyond, gagawin ko pa rin kung sa tingin ko gusto kong gawin for the service or whatever. Dapat ganun lahat attitude natin. Hindi parang yung iba ayaw, hihilain ka. Kasi matutuwa sila parang, tinan mo, wala, dahil wala kami, bahala ka na dyan. You just, in life you have to pursue your goal, your passion, and you become resilient in things, diba? And you will achieve your goal. Kung hindi, lagi kang wala lang, negative, parang wala nangyari kasi sila ganun. Alam mo yung no? Mga bata kayo ganyan, di ba? That is professionally, no?
Yes.
And do not always, it's always nice to delineate your personal from your professional para hindi ka ma-affected emotionally. So you're grounded ka kasi pag pinersonal mo yon, wala na. Kasama na yan. Kaya yung mga bashers, di ba? Yung mga social media, ganun yon. Anong pakialam mo? Kilala mo ba sila? Di ba? Di ba? Ganun lang pala. And I thank you. I'm very fortunate to have you guys to work with you. Actually, hindi yung kayo work, to work with you. Because I've learned from you guys. Alam mo yon, ganun yun. It's a learning thing, di ba? So you have to be very patient sa akin, di ba? Senior na. Sasabihin ko na ba ang edad ko? Sabihin ko na. The last time na inano ko ng kabilang network, lahat ng host umiyak. Sabi ko, diba ako dapat iiyak? Ba't iiyakan kayo? But of course, di ba? Ano pa? Wala na, yun lang. Oo.
Grabe.
Okay.
Ayan, yung way na magsalita rin si Doc ngayon and yung how he says things, isa yun sa mga nakuha ko sa kanya. Feel ko yung mga natutunan ko sa kanya with how he handles things. Kasi before, ano eh, 'di ba na-mention mo Doc yung ano, yung kapag ayaw nila, wag mong pilitin. Parang you just do yourself. Gawin mo lang yung mga kaya mo gano'n. Yun yung
Totoo,
nakuha
di
ko kay
ba?
Doc ngayon.
Totoo, di ba, Mitzi? Di
Yes.
ba? Totoo, di
It
ba?
was negative, ganyan.
Gawin
Para
nyo
stay
lang.
fresh, kaya
And I always tell Pocholo na sabi ko, your students have great voice. You have trained them on that aspect, whatever, di ba? Sabi nga si Freddie, the mellow voice. But ako siguro, ang maaano ko lang sila is hosting. Iba kasi yung hosting eh, di ba? So, ako kasi na-train ako doon ng mga mentors ko sa iba-iba network. So, ibig sabihin hosting, how you deal with your guests, how you banter, like apat tayo, iba yun eh. Maganda nga boses mo, hindi mo naman mailabas. Anong nangyayari dyan? O, ilagay mo na lang, di ba, Freddie Jihan sa bote ang boses mo at itapon mo sa ocean, baka makuha ng Serena yan. Di ba? Tama ba yun? Sabi ko nga kay Mitzi lagi, if you gain ground and mature in hosting, mas may element yan kasi magagandang boses niyo. Di ba? Mas magandang niyan, tirada. Of course, ako, joke lang, but I love to talk and I love to banter. My forte is bantering. Ibig sabihin, usap-usap tayo, gano'n. Kaya, I love shows like that. And I thank you. May nanalo na.
well, di ba tayo tapos, Doc? Di ba tayo tapos?
Meron pa?
Hindi pa. Meron pa. Okay? Sige po, let us
Get
share
ready.
it muna. Okay. Ito na. Okay?
Yes. God.
I get emotional when it's about my
Happy birthday,
family.
Doc Joseph.
Oh my God.
Thank you for being a brother and advisor. Take care always. More health shows to come. Love you always. Hi, bro! Happy birthday! Wishing you more blessings and good health. Thanks, bro, for everything you do, and congrats to your show. To my dearest celebrity doctor, stay safe always and more success and happiness. You are my idol, my hero, bro. Happy birthday!
Birthday, my son, Doc Joseph. Stay healthy always. More health show. Happy birthday. Love you.
Oh my God.
Yes. God.
Grabe, panalo kayo. How did you get them to talk? How did you get them to talk? They don't talk, lalo na nanay ko. How did you get their numbers?
Remember, Doc, when I asked kung sino po si Sir Jerome Lee?
Okay.
Yon. I asked him if ano po, if pwede. So, actually, nahihiya nga po sila nung una. But through the help of Sir Joey din, Sir Joey Gamboa, uh, they were able to, to send videos. Tapos sabi ko nga kung pwede sila sumali ngayon. Kanina pumasok si Sir Jerome pero I'm not sure if papasok pa rin siya ulit. But yun. So, thank you po pala sa sa family ni Doc Joseph for
Yeah,
saying
yeah.
yes and
Yes.
sending their video.
Oo nga eh. Yun. Oo. Maiyak ba ako? Hindi. Okay. My mother, I've always, they're my life. When my father died, I have been taking care of her like more than 20 years na siguro. She's 78 now. Hindi ko alam paano niya masapasalita. Buti walang sinasabi sa akin.
Surprise!
Grabe, pati mga kapatid ko. Mga shy yun eh, hindi na lang alabas. Ganon. Pero thank you very much and thank you very much for the awesome work you've done. Yun. Galing. Yan, believe na ako sa'yo, Mitzie. The other two networks, hindi nila napalabas.
Oh my gosh. Well, ano lang naman, Doc, to make you even more happier and ma-feel mong birthday mo pa rin hanggang ngayon. It's your week. Hindi mo day, week. It's your week.
Hanggang next week yata ito meron pa.
Alright.
Kaya pala tahimik lang si Mitzi this past few weeks. Meron pala siyang pakulo.
Oo, alam mo, Jihan,
May
hindi nila
surprise.
sinasabi. Pati yung sibling ko, hindi sinasabi. Sabi ko, huwag niyo ako pagtataguan ng ano-ano dyan. Kahit na, kagaya kanina, nag-uusap lang kami ng mom
Oh my
ko.
gosh.
Sabi ko, wala. Hindi nga na manunood ng show eh. Hindi nga nagbabanggit. Do you have a show? Wala. Deadma. Alam mo, Deadma yan. Mga parang pathetic lang. Meron palang hindi mo kinakabahan, baka sabihan ko, nandiyan kayo, at pinasuot nyo palang pula yung dalawa.
So, happy birthday, Doc.
Oy, thank you.
Happy birthday.
Happy birthday!
Thank you. This is so awesome. Love you all. May
We
gift
love
kayo
you
sa
too! I love
May gift kayo
too.
sa akin sa December, ha? Gcash na niyo, ha?
Yan,
Grabe ka,
sige.
Doc.
Aabot ba sa'yo, Freddie? Gcash
May
ko
Gcash
lang.
naman po ako.
I'll ask my staff to do it
Usapang
for me.
Gcash na!
Marami po tayong
Ah,
Gcash
ganun.
dyan.
Ay, promise yan.
Grabe.
Okay,
And
meron
of
pa ba?
course, yes, Doc. Di ba,
Meron pa?
sa naman, sa health show naman, Doc, kasi di ba last November 8, we also celebrated our first anniversary. November 8 po unang nag-show
Okay.
ang The Sunday Health Show. So, yan,
Alright.
happy anniversary po
Oh, yeah, happy
to
anniversary
us, to
sa atin.
everyone. Yan,
Oo.
so, congratulations din kasi grabe din yung improvement.
Oo, mula sa Ate Janine mo, kay Christian, sino pa?
Mhm.
Kay Ivana.
Ivana.
Sino pa yung isa? Yung mga nakalimutan ko, si Jello, kayo, si CJ, yan. Sino pa ang kulang? Wala na, hindi ko na alam.
Sir
Wala,
Richard.
Oh,
Sir
si
Rich
Richard.
din
Oh,
po,
si
Sir
Richie.
Rich.
Yan. Thank you for
Yan.
your effort. Alam mo naman, pumapasok lang naman ako dito sa platform. Hindi ako marunong ganyan up to now.
Pero yung guest natin, yung mga bonggang guest, of course, galing sa ating bonggang doctor, si Doc Joseph.
yes.
Diba?
Yun.
Agree,
Trabaho ko
agree.
Yun.
Oo, syempre. So, sino ang bonggang guest natin? Meron pa sasabihin kayo?
Yes. That's all, Doc, for yung aming
Thank you.
munting surprise for you. So for now, let's now start the rundown of our segment. So, okay, sit
Okay.
back, relax, and bubusugin na po natin ng kaalaman ang ating viewers. We have now celebrated, nag-double celeb na tayo ngayon, birthday ni
Yes,
Doc, and
thank
of course
you.
yung yes, yung anniversary natin. Ngayon naman, rundown ng segments. Let's go, Sir Freddie.
Yes, thank you very much. Again, Sir Doc Joseph, happy birthday. Hi, Mitzie, good morning. And also kay Jihan. And ako po ay isang nurse from Amiri Hospital dito po sa Kuwait. Day off ko po ngayon, hindi po katulad last time. Ngayon po ay hatid ko sa inyo. Di ba? Nagtago ako sa doctor's quarter last time. Okay, nandito na ako. Ahatin ko sa inyo ang mga balitang pangkalusugan galing sa lokal at international scene at nangunguna ang pagsusulong sa paggamit ng pandaigdigang access sa insulin. At pangalawa ay ang koponan ng Saudi Arabia, hinarang ang deal sabi ng mga Greenpeace at 150,000 doses na bakuna sa COVID-19 sunog sa Pagadian City. At sa bawat episode ay tutulungan namin kayong ganap na maintindihan ang ilang medical terms. Kasama, siyempre, ang ating kapatid na si Jihan.
Yes, say hey, happy birthday, Doc Lee. And ako si Jihan, ako ang inyong tagapaghatid ng midterm today, kung saan pabaon ng Sunday Health Show, ang usual.
Okay, nawala po si Ate Jihan. So, alright. Okay, sa ngalan po ni Ate Jihan, she'll be back in a few minutes. Siya po ang tagapaghatid ng MedTerm today kung saan pabaon ng health show ang usual medical terms na madalas binabanggit ng mga doktor sa kanilang mga pasyente. So alamin natin ang MedTerm today ang homeopathy later. So para naman sa pangkaragdagang kaalaman galing sa Sunday Health Show, we have ang Approve yan. Alam niyo naman po sa bawat episode ng Sunday Health Show ay meron kaming ibabahaging innovation sa larangan ng medisina, pati na rin yung mga medical apps na maaari nating i-download at magamit everyday sa ating mga gadgets. At huwag kayong mag-alala dahil lahat ng aming ibabahagi po ay suportado at aprobado ng health show. So, ngayong 5th episode, abangan po natin ang Approve Yarn. So, kung meron tayong balitang kalusugan galing kay Nurse Freddie, at MedTerm galing kay Ate Jihan at pangkaradagang kaalaman patungkol sa medical apps sa Approve Yarn, hatid naman sa inyo namin ni Doc Joseph ang malalimang usapan sa kwentong kalusugan. So hindi po talaga mawawala sa Sunday Health Show ang malawakang usapin tungkol sa aming napili na topic ngayong linggo. And we all know how the Sunday Health Show advocates getting the right information and knowledge from the expert mismo. So, kaya abangan ang ating diskusyon patungkol sa aging of the second phase. Ano nga ba yon? Women's Aging Reproductive Health, explained by Dr. Jennifer Jose. So, bago po tayo magsimula, bati po tayo ng onti sa comments kasi kanina sunod-sunod sila. Alright? Okay. Yan.
Hey, sorry about that.
Yes, it's okay, ate.
Alam mo,
Ayan,
kala ko
morning.
kakanta kayo.
Malapit na nga, Doc. Kaya lang kulang sa time.
Ay,
Ayan.
jello.
Ayan. Ay, si Sir Freddie, bumati. Ayan.
Uy, si Jermaine.
Yan. From Miss Anna Jermaine V. Bombasi. Hello, Doc Jennifer Marie Bernardo Jose and Doc Joseph Lee. Ayan. From Lance Padilla. Great day po, the Sunday Health Show. Happy birthday to Doc
Oy,
Lee.
Lance.
And of course, ang ating content producer, bumabati, Kuya Jello. Happy birthday, Doc Lee. Ayan. Sino pa ba?
Morning,
Sir
Jello.
Freddie, kayo naman. Ayan.
Ayan, galing kay Aluth
Mami ka
Madrilejos.
pala.
Yes, mamit mo.
Yes,
Great day and happy.
Pinasa ko pa kay Sir Freddie, no?
Yes. Okay lang yan para ako din magbasa. Great day and happy birthday, Doc Joseph Lee. Wishing you a good health. Wishing you good health always. God bless you more. Yan.
Yeah.
From
At
Jello de la Paz
yes.
again. It's double celebration pala. Doc Lee's birthday and the Sunday Health Show first year.
Okay. Last one from Miss May Ortiz. Good morning daw. Good morning din po sa inyo. Okay, so there we
Yan,
have
friend ko yan
it.
sa Kuwait. Friend ko yan sa
Oh,
Kuwait, yes.
hello po.
Wow, from
Hello.
Kuwait.
Siya pong presidente ng BISDAC.
Marami na nanonood sa'yo, Freddie, sa Kuwait every Sunday.
Marami na rin po.
Oh. Diba? Lumalawak talaga yung reach. O diba? StreamYard talaga, sabi nga ni Doc Eric noon, yards yung inaabot ng stream.
Yes.
Ibang ginagawa ng online social media. Diba?
True.
Maganda. Okay.
Yan, may humabol po yata. May humabol pong isa. From Ellen Valderas.
Oh.
Yan. Doc, pwede ang babaeng inom ng Genesis Spirulina? Salamat po.
Oo naman. Pwede. Pwede. Why not?
Okay. So, Ate Jihan?
Yes, and there you have it. Hold on.
Okay. Ayan.
Parang nilipat tayo.
Ang mainit at magandang tanghali po sa inyong lahat. Huwag bibitiw at ito na ang balitang tulusuyan para sa linggong ito.
Okay, Sir Freddie, let's go. Loading. Pasensya na po.
Go, Freddie.
Ayan. Yan, bago po mainlang sa ating balitaan, atin munang tingnan ang datos ng ating pandaigdigang bilang sa COVID-19 cases. Sa world statistics, umabot na tayo sa 253,671,109. And for recoveries, there's about 229,377 229,377,171. At sa Pilipinas naman, umabot na ang COVID number cases natin sa 2,815,080. And recoveries, we have 2,740,426. Magandang umaga sa inyong lahat, mga kapatiran saan man sa mundo. Ito ang inyong tagapagbalita. The Mellow Voice, maghahatid ng ulat sa balitang pangkalusugan. Pagsusulong sa paggamit ng pandaigdigang akses sa insulin. Sa loob ng 100 taong matapos sa pagtuklas ng insulin, lumabas na ito pa rin ang ginagamit ng mga karamihan sa pangkat ng mga diabetic sa buong mundo. Ang isang bagong ulat na inilathala ng World Health Organization sa lead-up sa World Diabetes Day na siyang nag-highlights sa maalarmang estado ng global access sa insulin at pag-aalaga ng diabetes at mataas na presyo nito, mababang availability ng insulin para sa mga pasyente at ilang mga producer na dominante sa pag-angkat ng merkado ng insulin. At kadalasan mahina ang mga sistema ng kalusugan at isa ang mga pangunahing hadlang sa universal na pag-access nito. Ito ang sabi ng World Health Director General na si Dr. Tedros Adhanom Ghebreyesus. Ang insulin ay natatanging gamot para sa mga diabetes. Ito ay maaaring isang daan upang ikamatay ng mga 9 milyong tao na may type 1 diabetes at para sa higit na 60 milyong katao na may type 2 na diabetes. Mahalaga ang insulin sa pagbabawas ng panganib sa ating bato, maaaring pagkabulag at pagkaputol ng paa. Gayunpaman ang isa sa bawat 2 tao na nangangailangan ng insulin para sa type 2 na diabetes ay hindi nakakakuha nito. Ang diabetes ay tumaas na sa ibang mga bansa at gayunpaman ang kanilang pagkonsumo ng insulin ay hindi pinapanatiling mataas sa lumalaking pasanin ng mga may sakit. Tinatampok ang ulat na habang 3 sa 4 na taong apektado ng type 2 at diabetes ay nakatira sa mga bansa sa labas ng Hilagang Amerika at Europa. Nagkakaroon din sila ng mas mababa sa 40% na kita mula sa benta ng insulin. Ang pagpapalawak ng programang pre-qualification ng World Health Organization upang isama ang mga gamitan sa pagmamanman ng glucose, mga test strips at diagnostic tools at ang pagsasama ng mga karagdagang anyo ng insulin at iba pang mga gamot sa diabetes sa pinakabagong update ng World Health Organization Model List of Essential Medicines ay inaasahan na humantong sa pinakamabuting pag-access sa mga bansa kung saan ang demand ay kasalukuyang hindi na makamtan. At sa mga ulat dito sa gitnang silangan, mga nagbabagang balita. Kupunan ng Saudi Arabia, hinarang ang deal, sabi ng Greenpeace Group. Sinasabi ng Saudi Arabia na inangkin nito at hinahadlangan ang deal sa COP26 at nagsasabing isang impostor at isang kasinungalingan. Ngunit sinasabi ng Greenpeace na nakasaksi ng mga negosyador ng kupunan ng bansa na humahadlang sa pagkilos ng pagbabago ng klima. Sinabi ni Juan Pablo Osornio, pinuno ng delegasyon ng Greenpeace sa COP26 na nasaksihan ng mga negosyador ang pangkat ng Saudi sa pagpapahina sa mga karapatang pantao, pagbabawal sa pinansyal na suporta para sa pagbagay at pagtatalo laban sa bansa na umaabot sa anumang huling teksto ng desisyon sa Glasgow. Ang Saudi Energy Minister na si Prince Abdul Aziz bin Salman Al Saud ay tumawag para sa pagkilala sa pagkakaiba-iba ng solusyon sa klima upang mabawasan ang emissions ng walang anumang bias patungo o anumang laban sa partikular na pinagkukunan ng enerhiya. Ang Saudi Arabia ay isa sa mga pinakamaling producer ng langis at exporters sa mundo at sinabi ni Osornio kung ang mga bansa ay hindi gusto ang pinangangalanan bilang blocker ng pagkilos ng klima, dapat nilang itigil ang pagharang ng detalye lalo na't ang tungkol sa usaping pang-klima. At dumako tayo sa ating minamahal na bayang Maharlika, ang Pilipinas. 150,000 doses ng mga bakuna sa COVID-19 sunog sa Pagadian City. Halos 150,000 doses na ng bakuna ng COVID-19 ang nawala sa isang sunog na sumiklab sa Provincial Health Office ng Zamboanga del Sur na naanantana ang pagbabakuna sa rehiyon ng Zamboanga Peninsula. Sinabi ito ng gobyerno noong Martes. Ang halos 5 oras na sunog noong nakarang linggo ay dumaan sa panalawigang cold storage facility na matatagpuan sa Integrated Provincial Health Office sa Pagadian City, ang kabisera ng Zamboanga del Sur, kung saan itinago ang iba't ibang tatak ng bakuna. Ayon sa ang kagawaran ng kalusugan at ang kagawaran ng panloob ng pamahalang lokal, ang sunog ay sumira sa 148,678 doses, 88,938 ng Pfizer, 64 ng Sinovac at 14,400 ng Moderna bakuna at 9,176 ng AstraZeneca. Sinabi ng pahayag na sinira rin ng sunog isang tinutukoy na bilang ng bakuna laban sa hepatitis, tigdas at polio. Ang sanhi ng sunog ay hindi pa rin alam at isang pagsisiyasat pa ang sinasagawa. Ang lahat ng ahensya ay nasa standby upang magbigay ng agarang suporta sa regional at local vaccination operations center sa Zamboanga Peninsula, sabi ng pahayag. Tinitiyak ng 3 ahensya na mga residente ng lalawigan, lalo ng mga naka-schedule na tumanggap ng kanilang pangalawang dose, na ang bakuna ay mapapalitan. Dahil sa bilang ng mga doses na nawasak at napinsala sa pasilidad ng imbakan, ang pangangasiwa ng bakuna sa mga antas ng probinsya at munisipal ay muling i-schedule. Ngunit ang bagong petsa ay muling ihahayag. Muli ay sumasaing pawid at ang inyong narinig ang balitang pangkalusugan. Ito ang inyong lingkod mula sa malamyos na tinig, The Mellow Voice. Freddie Tayoan, nag-uulat.
Yes, indeed, talagang malamyos. Grabe.
Yan, magandang umaga po ulit sa inyong lahat. Atin po narinig ang mga maraming balita patungkol sa COVID-19, di ba? Parang ang sakit sa loob na may masunog. Imagine mo yun. Ang daming dapat makareceive pa nito.
Ano yan eh, yung transfer yan ng ng vaccine, I think they're investigating it already. Kasi once it is given to a provincial local government, kailangan may proper kung saan mo ilalagay, kung sa anong health center na gagamitin, kung na hospital assign, kailangan na-distribute na yan. Ang problema kasi, pag hindi pa na-distribute at nagkaroon ng problema, ayan, diba? Refrigeration and storage is very, very important. Yun ang natin. Anyway, yung cases nyo sa ano, sa Kuwait, okay, yung okay naman ang COVID. Kasi dito, di ba, Mitzi, Jihan, bumababa na. But we have, ano,
Yes.
detected one,
A new
2 years
variant.
old. Yeah,
Yes,
besides the
in
new
Pampanga.
variant, there is a sa Pampanga, there is a 2-year-old child who had COVID. Kasi level 2 na, naglabasan na lahat. Kailangan ng mga health protocol nandiyan pa rin, ha?
True.
Tama,
Huwag
Doc.
masyadong, di ba? Sa inyo, Freddie, ganyan din?
Yeah, green
Naglabasan na
ano
sa
na po kami
mall?
dito. Okay na po kami dito sa Kuwait. Open na po lahat. Lahat po ng struktura, lahat po ng area pwede na pong pasukan. Tulad ngayon sa amin pong ward, we only have 1 or 2 patients at negative naman po sila. And around Kuwait, yan, okay na po. Green na ano na po ang aming ang bansa ng Kuwait.
Wow.
When you say green, what is that? So parang level 1 namin?
Balik na po sa normal. Balik na po sa normal.
Pag green, oo. Pag red, ibig sabihin,
Ayun, pag red,
heightened
ano
alert.
pa, by level pa po yan. So dito, ano na, go na po dito, yes. So balik na din po mga schooling at lahat.
Wow, face to
Alam niyo po
face.
ba sa London, Doc, actually, wala na, hindi na po sila nagfe-face mask, hindi na sila nagfe-face shield, as in, normal na daw doon, Doc. Yun yung current balita na nabasa ko po.
But I got it from my nurse there. Kasi he was asking me, when are you traveling back to London? Sabi ko, siguro mga 2023. Clear na ba ang UK by then? Okay na, kagaya sinabi ni Mitzi, back to normal. But there are still cases there na a day daw may 25,000. Pero it seems that parang they are surviving and living with the virus already. So parang, alam mo, Jihan, Freddie, parang, okay lang, sige, parang common cold, gano'n na lang ang ano nila. Parang ayaw na nila mag-lockdown. So, gano'n. So, we just have to be very careful also.
Yeah.
Di ba, Doc, kung malala mo din, Doc, yung MRSA natin dati, di ba, nakakaano din yan, nakakatakot dati. So, I think this is, ganun na rin po ang nangyayari dito. In Kuwait, wala na po kaming, parang kumbaga, Kuwait na po yun, ang cases po namin per day.
Alam mo, mas nakakatakot ang measles natin, Mitzie at
yes.
mga
Opo,
COVID.
totoo po.
Mas nakakatakot
Totoo po.
ang complication noon. If you know, kaya nga yung mga bata, di ba,
Important vaccine.
If they only knew. Di ba? Meningitis, abot yan agad. Di ba? Very good.
Okay. So, alright. So, I think complete na. Let's go, Sir Freddie.
Ayan na nga at napag-usapan na natin ang homeopathy. Jihan, discuss mo na ang ating midterm today.
Yes. Thank you, Nurse Freddie.
May may yung video natin. Nakalimutan natin.
Excited?
Yes, ang intro natin. Excited.
Yes, it's time for our medical term for today, homeopathy. Nanggaling ito sa homeo or omeo meaning similar and pathos meaning suffering. According to the University of Michigan Health, homeopathy or homeopathic medicine is a medical philosophy and practice based on the idea that the body has the ability to heal itself. It uses pills or liquid mixtures or solutions containing only a little of an active ingredient, usually a plant or mineral for treatment of disease. Homeopathic remedies have been regulated in the United States since 1938. They're thought to be safe in most cases, but some of these products may cause side effects. Yeah.
Okay.
Yes, and for our approved yan, here's the medical app you could use. Flow app. Ginagamit ko siya and very related siya sa ating guest for today. Dahil ang app na ito ay isang AI-based tracker for period and ovulation prediction. Nakakatulong siya sa pagtingin ng ilang senyales sa katawan tulad ng cramps, discharge, pananakit ng ulo, and it helps identify body patterns dahil naiintindihan nito ang unique symptoms at ikinakategorya ang normality ng experiences at nag-a-assist sa pregnancy planning and monitoring habang nagbabahagi ng isang avenue para sa expert insights at discussions. May malaking tulong tong app na to sa ating mga kababaihan dahil nakikip track natin ng importanteng impormasyon na makakatulong sa atin dahil magiging handa tayo kapag tinanong tayo ng ating mga doktor kapag kinailangan nila ang history natin. Ang app na ito ay maaari nating maging gabay upang mapadali ang communication sa ating OB kapag tayo ay magpapacheck up na. Bilang isang babae ay mas maganda na makilala natin ang ating katawan upang ma-monitor natin kung healthy pa ba tayo or kung nais naman natin na ating mga kumars na magplanong magbuntis ay mas madaling masusubaybayan ang ating cycle sa tulong ng app na ito. Pwedeng kalasugan naman na susunod after a short break.
I love my coffee. Every morning before I go to work, I use my Trinodent Gold Mouthwash. Ginagamit ko to kasi mabisang pagpusa ng unang bacteria. Subukan ninyo.
Okay! Hello, Doc! Welcome back!
Yes!
It's Kwentong
Welcome.
Kalusugan!
Oo, core o pinaka-exciting portion ng ating The Sunday Health Show. Of course, this is exciting. Of course, the other segments are exciting, but this is exciting because we have invited very good and well-established, high-caliber resource individual. Okay? So, Mitzie, it's your turn to introduce our resource person.
Yes. Doc, before we introduce our guest for today pala, para ma-intro or ma-preempt natin yung viewers sa topic natin. Doon kasi sa video kanina ni Sir Joey, sabi niya, vet daw yung una mong gusto. Tapos naging physician, and then ngayon yung specialization mo po is naging urologist. Since yung guest natin, medyo similar sa topic mo, Doc, bakit urologist muna yung pinili mong specialization?
Because I have very good mentors during my training in DMMC. No, it's just very sad because one of my idol mentor passed away last year. No, because of certain ailment. Hindi COVID, a certain ailment. So I have very good because during the time kasi urologist was not really a hit, no? Aesthetic, plastic surgery, more of constructive reconstruction, no? Yung cleft palate, mga ganon. Aesthetic meron, yung mga rhinoplasty, kagaya ni Doc Mark, no? Pero not really,
Yes, Doc.
at that point. And general surgery was there. But urology as a subspecialty was not really that renowned at that time.
Yeah.
So that was like 30 years ago, 30 plus years, or 30 plus more years ago, di ba? And not like now, di ba? Alam na siya. Then, sabi ko, why not? Hindi ko alam na okay naman siya. Now, yung guest natin, who is a good friend of mine, he will be talking of something very interesting on female aesthetics. No, I do the male part of the aesthetic. No, so
Yeah.
we'll try to listen to what she will tell us with regards to how
Yeah.
we rejuvenate, regenerate,
Intriguing to, Doc.
at maging ano ba yung pangalawang muka? May muka, isa
Yeah.
lang ang muka, di ba? Bakit may pangalawang muka, Mitzi? Yun.
Yan. So, malalaman po natin kung ano nga ba yung sinasabi ng poster natin na may second face daw. Yan. So, thank you, Doc. Thank you for sharing it kasi I just noticed na may similarity yung field ni Doc and yung specialization ng guest speaker po natin. So, at least we're able to give our viewers a short or maybe mini bird's eye view to what we'll discuss. So, alright, Doc. Tara na po
Yep.
sa
Let's
kwentuhan.
go!
Yes. Okay, let me introduce to you our guest speaker for today. Okay, she is the Vice President of Aesthetic Gynecologic Society of the Philippines, a Senior Fellow of European Society of Aesthetic Gynecology, Head Urogynecology and Pelvic Reconstructive Surgery at Makati Medical Center in St. Luke's Global City. She was selected to receive the 100 Most Influential Filipino Women in the World Award, Global FWN 100 in 2017. She's a member of Cosmetic Gynecology Writing Group, International Urogynecology Association. She's also a Distinguished Alumni Award 2019 receiver from University of East Ramon Magsaysay Memorial Medical Center. She was also recognized by St. Luke's Medical Center as an outstanding physician involved in innovation in treatment and pioneering work, Trailblazer Award given by the Da Vinci Surgical System. She is an international proctor of Intuitive Surgical Incorporation, conducted live surgeries and training in Vietnam, Malaysia, Korea, and Singapore. Also a clinical and research fellowship urogynecology and pelvic reconstructive surgery at Mount Sinai Hospital, University of Toronto, Canada. And also, she is the first surgeon in the Philippines to use robotics for women care. So, all right, let's roll the carpet for Dr. Jennifer Marie B. Jose.
Hi.
Alright.
Hello. Good afternoon.
Hello. Good afternoon.
Thank you very
afternoon,
much for that
Doc.
very kind introduction.
Oh nga, Doc.
Alam mo,
Overwhelming.
Mitzi, yan
Yes, Doc.
sinasabi, world renowned. Yan,
True.
ang title, isa lang yan, title ng aking good friend na si Jenny, di ba? Urogynecologist, aesthetic, tapos et cetera, et cetera. O hindi, wala pa yung mga title niya, ha? Yung chairman ng ganyan. Wala pa, nako. And the best thing about Jenny is she is the most perfectly humble with a great heart. Diba? Yan. At magaling na lecturer yan. My God.
Oo nga, Doc. I can't wait. For our season 3, si Doc Jenny po ang may kauna-unahang may lecture for our season 3.
Wow.
Yan.
Yes, of course.
So, Doc Jenny, we're looking forward sa discussion this afternoon, lalo na sabi ko kanina, intriguing and fascinating po yung topic. So, before we start, Doc, baka may gusto kayong batiin or i-share?
Dr. Lee, I'm actually good. I'm not into really social media.
Na-shy bigla.
Go,
You wanna
We're
greet
here.
somebody? You wanna
Go
go?
pa.
You have to promote your upcoming lecture in Euronap. Oh yeah.
Oh yes,
Oh.
I'm going to have this. I'm an invited speaker for ORNAP. It's going to be November 20. I hope you could
Mm-mm.
come and watch the lecture. I'm very sure that you will be able to relate, okay, and understand
Mm-hmm.
a lot of things about women.
Mm-mm. And Mitzi,
Yeah.
she just finished I think a workshop ba, friend, noong November
This
11, the
Ah, yes.
POGS, no? Oo.
Yes, we just finished also the POGS simultaneous session, and our topic is sexual medicine, which is actually very new in the country too.
taboo.
Dr. Feliz
Oo.
Apartidera and I, Feliz, right? Joseph, friend din
Yeah,
natin
of
yun.
course.
We were together in
Oo,
giving
si
the
Feliz.
lecture.
Alright.
Yes.
O,
Oh,
diba? You
okay.
know, I'm updated, Alam ko ang mga schedule mo.
I know, I'm surprised. Mas magaling ka pa sa akin eh.
Oo nga. Tsaka
Okay.
thank you, Doc, for the time,
Mm-mm.
for your time today. We know you're very busy, and I'm really thankful po talaga we really got to talk agad
Oh,
before the
yeah.
show start, 'di ba? Di kami
Right.
magpang-abot nung una ni Doc. So thank
Oo,
you po.
alam mo, Mitzi, Sunday yan, mag-oopera pa yan. Sabi niya sa
Oh my
akin,
gosh.
Joseph, I have a case, a robotic case. What time is it? Sasabihin ko na, still off. Okay, I'll move my case. OMG, she's moving her case for us. Oo, di ba?
Oy,
Oh. Kaya
thank
really,
you.
really grateful, Jenny.
Ay, naku
Okay.
naman. Anytime, I'm gonna help, ha? With you pa,
Thank
Joseph,
you.
no?
Oo.
Thank you
Kasi if
po.
Yeah,
you
thank
are
you. And
part
thank you for
of the show
inviting.
na, you can always promote whatever. You just tell Mitzi yung mga activities
Mm-hmm.
mo, convention mo, if you want, if your fellowship, we allow you. Walang
Oh,
charge
thank you
yan.
very much.
Just promote, oo, kasi you're part of the show.
Yes.
Di ba may iba, you wanna promote something, di ba? It's kind of difficult. Now you just contact Mitzi. Mitzi,
Mm-hmm.
promote mo naman
Oh,
ito. Go, we'll promote it.
Opo, if
Kasi
you want to
uh-uh.
share, ganun, we can share it sa
Oo.
page din po.
Kasi our
Thank you very
this
much.
show goes up to the States and to the Middle East, 'di ba? Yung mga natin doon, mga guests natin
Yes.
Mitzi from the States, they also promote their stuff.
Oh,
And
okay.
okay naman, 'di ba? Ikaw naman international ka eh. World renowned ka nga eh. Okay.
Mm-mm.
So anong
Thank
topic
you.
mo?
Thank you.
Anong topic mo?
Well,
Nako,
remember the
what?
most exciting? Like, in the clinic, people are asking me, what's my face? What's my second face? And they tend to get their mirrors at the end of the day and look at
Oo.
themselves. So now, majority of my patients in the clinic know about the second face. So I hope after giving this a short lecture, a lot of us would also be conscious about our second face, or, just be very
Yon.
vocal of, what
Mm.
we need and what we want to improve
Okay.
our self-confidence with. Mm-hmm.
Okay, so you
Yes.
have to tell now our online viewers and our televiewers what is the second phase?
Okay,
True.
great.
Take it away,
Yeah.
Jenny.
Okay.
Okay.
So, okay, are the slides ready po, Doc?
Yes, I'm just gonna share them, right? Okay.
Okay
Mm-hmm.
po. Okay, so while we're waiting for Doc Jenny to share it, maybe we could also ask her po regarding let's another preempt sa viewers. Doc, ito, first question before we start in interview slide. Ayan. Regarding your
Okay.
specialization as a urogynecologist based on your credentials earlier. Kasi
Yes.
to be honest, it's my first time to encounter a doctor of your field po. So,
Oh,
to help us and our viewers understand also, what
yes.
does a urogynecologist do? Kasi 'di ba po for most
Okay.
women, including
Mm-hmm.
I of course, when we think of a doctor who is responsible in evaluating women's reproductive health, iisa lang po yung nasa isip in general po, no? That's OB-GYN. And
OBGYN,
yeah,
right?
opo. Kapag
Mm-hmm.
sa men naman, we have Doc Joseph, the urologist. And
Right.
little did we know,
Yeah.
there's also a specialist called urogynecologist. So,
Yes.
what
Mm.
does a urogynecologist do? Are you focused in the care
Okay.
of women's urinary system only, or focus on
Mhm.
both women's urinary and reproductive health?
Okay. Actually, a urogynecologist is an obstetrician gynecologist, okay, but did specialized training on urinary incontinence. Do you know incontinence, like when you cough, when you sneeze, and when you laugh, you leak urine? These are the results of the perimenopause and also aging. Like you don't make it to the washroom, you go to the washroom very often, you leak at night, you wear diapers at night. So that is what we specialize on: urinary incontinence, prolapse. I don't know if you are familiar with PUA. You know, when the
Yep.
uterus is hanging out or your bladder hangs out. Why? Because of childbirth. All these are the effects of aging. And then the most common overactive bladder that we see among women. Why? Because we age. When you listen to my talk later, you will see what happens when you reach perimenopause and menopause. You become
Mm.
very dry down there and you get all these symptoms. So the urogynecologists are the ones who specialize on that. And
Mm.
it's actually a higher field in OBGYN in terms of incontinence, prolapses, and also bladder issues, and sometimes also rectal issues as well. Hmm.
Okay.
Yes,
So, okay, there we
So you
have
have
it.
so you
yes.
heard it, Mitzi.
Opo.
Dryness. Oo.
Yeah.
Napakinggan mo, ma'am, yan.
Talaga.
Bakit nagka-dry? As dry as a desert?
I'll show you later in my slides once I start. And I'm
Right.
sure you will have tons of questions for me.
Yeah,
Okay.
later. Okay,
Okay.
Doc.
All right.
Okay,
Sige.
you want
Sige.
me to start? Okay,
Yes,
Yes,
Doc.
I'm
go.
not
Let's
going to
go.
bore you. I promise you. Okay?
Yes. Okay.
I'm going to screen share now. Can you see my slide now?
Yes.
Yes, Doc. Opo.
Okay. Okay, so my topic will be aging of the second phase, women's aging reproductive health explained. Okay? So I'd like to show you what happens with menopause. There is decrease in ovarian function, decrease in the levels of estrogen, and the FSH and the LH increase. So what happens with women? They have hot flushes, night sweats, irritability, they become depressed, and they develop headaches. Okay? But what happens to their second phase? And I am actually pertaining to the vagina. And what they feel is that they experience dryness, dyspareunia, and urogenital atrophy that happens among all women. Okay. If you see all these diseases, look at the urogenital atrophy, it's 100%. Why? Because it happens as we reach perimenopause to menopause. So all individuals, all females will have this concern. Okay. Look, can you see the fruit over here? This is what
Yes.
happens
Suha.
to seasonal atrophic changes. You
Yeah.
have dryness, irritation and itching, discharge, dyspareunia, dysuria, urinary frequency, meaning you go to the washroom 8 times or more in the day, and also urinary incontinence, like what I mentioned earlier, that when you cough, when you sneeze, and when you laugh, you leak urine. So I'm here now because I'd like to present to you that we have to enjoy our aging, right? And we need to regenerate and we can actually improve our vaginal tissue so that we are not going to be symptomatic in terms of dryness, irritations, and recurrent UTI and also urinary incontinence. Okay. What happens with childbirth? As the baby passes through the birth canal, you can see that the pericervical fascia is actually torn. And because of this, you can see that the vagina becomes very lax, right? And what happens is that look at the aging vagina. The vagina sags and drops. You develop incontinence, prolapse, overactive bladder. A lot has orgasmic dysfunction. They have repetitive urinary tract infection and also repetitive vaginal infection. So, as women age, these are the things that happen. We have the genital urinary syndrome of menopause. vaginal relaxation syndrome, and also stress urinary incontinence. And we have different things that we need to take note because these are the five most common problems. Look, vaginal laxity. And this is because of young age of marriage and multiple pregnancy. As I've shown you the picture earlier, the vagina becomes lax, okay? And you develop leaking. It's not only when you cough, when you sneeze, and when you laugh. Most of the time, they don't make it to the washroom. They leak before getting there. And women now are more open. They really consult their doctor for this concern. Some would say that, naku, matanda na ako, magiging mapanghina ako. But actually, look, we can treat it. Okay? Because just imagine with a high proportion of one in every four women would suffer from urinary incontinence. And we do not want these women to be wearing pads, right? Some would actually complain of pain and discomfort during intercourse. And we also have what we call vaginismus. Actually, I've been treating vaginismus by injecting botulinum toxin in the vagina. And you can see that there is a big improvement in the quality of life and also marriage. Okay. Some would actually have embarrassment from the appearance of the vagina because as we grow old, it actually changes. Majority of women, it's like saying 95% of women would prefer that the contour is smooth and pleasing, the color is consistent and matching on both sides, and it is also symmetrical. And also, most women want their inner labia to be smaller and the outer labia to be fluffy. And that they should have smooth edges as well, and it would actually look very natural. Now, can you see this picture over here? Psychology books have mentioned that when men look at women and when they look at the lips of women, they're like looking at the vaginas, right? And I don't know if a lot of women are actually very familiar about this. That's why a lot of women would like to help in the have their vulvas and also vaginas improve in terms of appearance because this actually improves their self-confidence, right? Now,
Right.
how about sensation during sex? What can you see here? This is what I see with my patients. They say that sex doesn't feel the same anymore. Okay? So they need help. And what help can I give? Well, what I can actually offer them is to help them regenerate or rejuvenate their vaginal tissues internally and externally. Women would come with their vulvas and vaginas in different sizes, shapes, forms. So it's not only the aesthetic effect that is very important, but also the functional effect, okay? Which I will show you later. Now, I'd like to show you the current treatment options that I offer in my clinic because I deal with a lot of breakthrough technology. I have mentioned to you about the genital urinary syndrome of menopause because everybody will get this. They would have like a feeling of dryness, recurrent UTI, incontinence, and also recurrent vaginal infections. And it is actually a big problem that women deal with. Okay. And just to show you that this laser treatments that I am going to explain to you are actually accepted by the National Institute of Health and Care Excellence, and they use this for the treatment of the urogenital atrophy and also stress urinary incontinence. And this is actually accepted as a treatment when you reach perimenopause to menopause, right? So when you're around 45 to 48, normally females, they have reached their menopause at 48 to 52. The Filipinos get their menopause at that age. So it's good to start prior to reaching menopause so that they don't get the symptoms, okay? And this is actually very good because a lot of women in the clinic would complain of vaginal dryness and also pain with intercourse. There are a lot of books already published regarding this and journals, and it has been used widely, especially in Europe and also in the United States. Okay, and this has really has a very very good effect in the treatment of dryness, pain during intercourse, and you just need to repeat every 1 to 2 years. Okay, and this has been used in different countries as well. These lasers are actually in-office procedures, they're actually painless, quick healing, and almost no downtime. And this is good for the treatment of all these problems like for tightening, incontinence, dryness, treatment for cancer patients. Those who have breast cancer, they usually have the symptoms of dryness and irritation in the vagina, and they cannot be given hormones. So we can offer them the laser to help them in the lubrication. This is good for those who have vaginal laxity. As a treatment, we can give this to rehabilitate the vagina to address vestibulitis syndrome, infection, and also lichen sclerosis. So just to show you about the vaginal treatment, we put the probe in the vagina. It's like having a transvaginal ultrasound, and we actually run it. It is not painful. And look at the effect. As we do the laser, we give this for 3 sessions, 1 month apart. And you can see that there is buildup of collagen. So instead of it's actually thin and dry, okay, you become lubricated again. There is more blood vessels formed, more nerves are formed, so it becomes young again. Okay? So what happens when you do the laser? You get this collagen remodeling process. And all these are the effect of the lasers in the vagina. You have new blood vessel formation, tissue oxygenation, tissue lubrication, and also vaginal sensitivity. There are actually only very few side effects. You know, this is an outpatient procedure, and the patient can even go back to the office right away. And they can even have intercourse right away, even if the book would say that it's going to be better if we're going to have like intercourse after 3 days, you know, to take note of the and take charge of the edema time. But with my patients, they have the intercourse right away, and it's fine with them. And you can see here that it is actually pixelated. It stimulates the layers beneath the dermis to stimulate the collagen and elastin fibers to regenerate, because after the thermal damage, it creates a deep aseptic wound and the collagen remodels. We have the 3 sessions, 1 month apart, and you can see that after the damage, there is a proliferation phase and also the remodeling phase, which is continued even if you don't do the lasers anymore. Okay. So aside from the tissue remodeling mechanism, we also stimulate the different growth factors to regenerate healing. Okay. And after 21 days, what you can see here is that there is more collagen, there is more elastin that is formed, more glycogen, more lubrication, and the vagina becomes young again, and the patient doesn't have the symptoms after. So you can see that it is actually very practical, and there is no downtime, and there is no side effect, because this laser transmits into energy, which creates a photothermal effect, which leads to vasodilatation and edema. And this thermomechanical effect will lead to the production of more collagen and elastin fibers, and therefore there are new blood vessels formed and it restructures, and then the patient doesn't have the symptoms of dryness, pain, and they also have improvement in their incontinence. So this is actually very good in helping our women who reach perimenopause to menopause, because you can see the improvement right away with no side effects, right? So you can see from a very dry vagina, you can see that these women are actually very happy and they don't have all this discomfort. And I have mentioned to you about breast cancer because these patients are the ones who experience the symptoms of the dryness, itching, pain during intercourse, and also pain when they urinate. But you see, after doing these lasers, you can see that the symptoms are actually improved. And women come in different sizes and shapes. And of course, it's not only that, it's also the vulva and also the vagina that actually sags with aging. It's not only your first face that sags, but also your second face sags as well, right? And because of that, you know, a lot of women would like to regain their confidence, and we also offer like labia majora tightening. Sometimes we need to offer labiaplasty not only for aesthetic reasons but for functional reasons, because some of these patients cannot wear skin jeans because of the redundancy of the tissues, and then they develop a lot of infection and they have difficulty in cleaning themselves too. Just to let you know, we have like the platelet-rich plasma, which we flush into the vaginal tissues to help in the speeding up of the regeneration of the tissues as well. And I don't know if Dr. Lee has mentioned this before. I know he does the men, but like on my end, I do the G shot and the O shot, which helps in the improvement in the sensitivity for intercourse for women. Okay. And we also use the PRP for this. It's just that it has to be injected in the right areas in the vagina and also in the clitoris. So these are the things that actually are very important, and this is not only for aesthetic reasons but also for functional reasons. Now, when you ask women, is this a luxury or a necessity? Look at the reasons of these women doing this aesthetic procedures, okay? Because they want to have like a heightened sexual pleasure, and also they want to have a youthful looking genital. I noticed that before patients are actually very quiet about this, but now, even during the time of pandemic, I was telling Dr. Lee that they come for this procedure because for them this is actually very important too. Okay? And they want to do this because they want to have improvement in their appearance, self-confidence, and they want to have a better marital relationship. And also, like what I said, functional discomfort has to be addressed as well. Okay? So why do they do this? They're actually doing it for themselves, right? So how come they deal with aesthetic gynecology too? Some women would say, after having all these children, I stopped caring about myself, so now I think it's time to take care of myself again. And some would really would like to attract their husbands or even partners again, and they want to restore their beauty. Okay, and I think that is one main reason that's why women would like to address this concern because they want to put back their self confidence. And you see, this can also be used for the treatment of recurrent UTI that hasn't been treated by a lot of antibiotics. Why? Because when you do laser, you regenerate the vaginal tissue, and therefore you change the acidity of the vagina. Instead of getting to be basic, it becomes acidic again. You're returning the normal flora, and they become better. Now, look at this in terms of leaking. This happens as we age because this is the result of the dryness and also the aging pattern. And a lot of women are having concerns about this, but majority wouldn't actually consult their doctor for this. But just to let you know, when the vagina becomes dry, the urethra becomes dry as well. So you can see here that the urethra is actually open even at rest. But if you improve the tropism by doing this laser, you can actually help the patient hold the urine because you can see here that the tissues are actually thicker, okay? And therefore, we are able to address the urinary incontinence. So we also address the urinary incontinence with the use of lasers, of course, but you have to be assessed very well. We have the machines for this. So this probe is actually placed in the urethra, and the laser is actually set so that it would stimulate the regeneration of the urethral mucosa. Okay, and this helps for the stress incontinence and the genital urinary syndrome of menopause. And studies have shown that you can see there are more glycogen, meaning they lubricate more and more collagen are formed, and therefore the vagina becomes younger again. Okay, and the patient doesn't have the symptoms after. And look at the one hour podcast. You can see here that after the treatment, okay, there is improvement in terms of leaking. Why? Because the pad becomes lighter. Okay. And you can also see this by doing a 3-day voiding diary. You can see the incontinence and the volume of leakage is actually reduced. Just to let you know, we also have the I'd like to share with you the high fem technology. Like when you sit on it, it does 11,200 kegels in 28 minutes. So this is very good also to improve the blood supply and nerve supply to the vagina without effort. It's so hard to do kegels, right? And you have to be contracting the right muscles. But when you sit on it, it's contracting the right muscles And therefore, if you improve the blood supply and nerve supply, you also regenerate not only the pelvic floor but also the vaginal tissue. They're also programmed in this machine to help in sexual dysfunction too. And these are actually very good for patients who are aging, those who have delivered, menopause, and those who have overactive bladder as well. And this is also a walk in, walk out procedure. So this is the machine. It's just a throne that you're going to sit into it, and this would actually help your backboard, and this would help you to prevent you to have those leakages. Okay, so this is actually very good as well because it stimulates the entire pelvic floor area. So, do you have any questions? I hope I did not, complicate
Mhm.
things for you.
I have one question,
Yes,
Jenny.
Doctor.
Okay.
Yes, Joseph.
All right. They before we go to a vaginal aesthetic of or improvement of dryness, women always say, "How can we serve our partner or men?" Right? It's always like
Yes,
that. All right.
yes,
Okay. It's not being subserving or being submissive all the time, but
right,
when you talk about sexual performance, there should be a mutual understanding between two
right.
partners. So when do you say that you have a perfect vagina? So what is a perfect vagina, right?
Okay, yes.
I know this because you explained to me, but for our audience, what is a perfect vagina? Like, doctora, do I need to see you? Because I think my vagina or my second face looks okay. So when is it not okay? And when are you
Okay,
saying that it is okay?
okay. It's like this. Like I've mentioned to you earlier, that there is a big change when a woman reaches perimenopause and menopause, right? And like I've always mentioned in my presentation about the dryness, okay? So, of course, you want to improve it functionally and aesthetically. When you say about functionally, you have to be not dry, okay? There should not be pain so that they can have intercourse. So what I'm saying is it should not only be aesthetic, that it should look pretty, because like what I've mentioned, the vulva and the
Mm-hmm.
vagina has different sizes and also shapes, right? But the thing is, as we grow old, because of gravity and lack of estrogen, the vulva, like the face, sags too, right?
Mm-hmm.
So with our face, now it's out in the market. Everybody does radio frequency, RF in the face. I also
Yeah.
do RF in the vulva as well because you are
All
going to treat
right.
it as your second phase, right? But this isn't only not making the vulva and the vagina pretty, you're actually improving and stimulating the collagen and elastin fibers, not
Mm-hmm.
only to make
Mm-hmm.
it pretty but functional. So I think what is the perfect vagina? I think it should lubricate again. You have to have a good blood supply, a nerve supply
Mm-hmm.
also should be there.
Mm-hmm.
It should not be dry, no infection, and then it will actually improve the marital status or
Mm-hmm.
extramarital status of individuals.
So it's not only physical, right? It's not only the
Yeah,
physical.
no,
I think you're talking or we're dealing more of the functional effect,
functional.
right?
Yes,
Okay.
Mm,
Okay, Mitzi?
yeah. Yeah, because
okay.
remember what
Mm.
happens when we grow old? The
All
vagina
right.
becomes dry. Remember, the vagina has to be acidic so that you don't get a lot of infection because if it becomes basic,
Yeah.
different kinds of bacteria grow. That's why there's a lot of vaginal infection, vulvar infection, and also recurrent UTI,
That's
right?
it.
Mm,
That is why they
So,
always say, Jenny,
yeah,
that's why they always say you're mentioning about acidity. That's why they always say female washing. Oh, correct me if I'm right. Oh, Mitzi,
right.
kasi I don't.
there.
Female overwashing might cause into problem because you change the milieu
Yes,
of the pH.
that's
Mm,
true. That's very, very true, right? And it has to suit the person. Because, like, for instance, if the patient is already very dry, and let's say you're going to put a wash that is very high in acidity, then it's going to be more dry. And therefore, it becomes more itchy, more irritation, and a different
Right,
kind of
right.
bacteria grows. And then you have a series of
Mhm.
infection again.
All right.
Okay. Doc, you've
Mitzi.
mentioned ano po, different treatments earlier, and we are now talking about the wash, no? So, for regarding the pH, what is the best range of pH of female feminine wash that we should consider in
Okay.
buying?
First is first, it has to be acidic, right?
Mm-hmm.
Because when it becomes basic, then fungal infection will actually prevail. So, what is the normal pH of the vagina? Usually, it should be like 4 to 7. Okay,
4 to 7.
um, that is actually very important because if you make it going higher than that, you'll be surprised. Even if you clean yourself so much, you develop a lot of vaginal infection, and you really be surprised how
Correct.
come you're so
Mm-hmm.
clean, and then you're getting there. Hmm. Right?
Okay. So for our viewers who I know who does not understand or are curious what is basic, what's the acidic term that we are talking about, it's the acidity and alkalinity of
Hmm.
our second phase down there. So what Doc is
Right.
saying, the feminine wash that we should consider, it must be in the acidic pH. Yun, sabi
Yes.
nga, 4 to 7, okay, again. So if we are going to buy feminine wash, we have to check it 4 to 7, okay, ladies,
Hmm.
including me. Yeah.
You
Right.
know, I
Right.
like to
Right.
ask. I like to ask for your indulgence, Mitzi, Jenny, with regards to or during the 2 years of our lockdowns and pandemic, has
Joseph, can you
the
speak louder? Sorry.
okay? Can you hear me?
Yeah,
Okay,
I can hear
all
you
right.
now.
During the 2 years of the pandemic or the lockdown, okay, for all the patients that you had, like teleconsult or face-to-face even, or an hybrid consultation, what are the more interesting cases? When I say interesting, like dryness, vaginismus,
Yes.
Mm.
SUI or infection. What are the more common that you tend to see in your clinic?
Right.
Before I ask you regarding the aesthetic side, because I think during the lockdown there are a lot of people going into the aesthetic side. Okay.
Yes. Yes.
True.
True. Well, actually, because I'm a urogynecologist, okay, so majority of patients that I see, of course, they have incontinence, overactive bladder, and also they have the symptoms of the genitourinary syndrome of menopause, and that is dryness,
Mm-hmm.
irritation, vaginal infection. You know, you'll be surprised. Some would come also with prolapse. It's because of my field, right? But surprisingly, during the pandemic, a lot of women come and see me. They become open to me, and I'm so surprised because they tell me that they have problems with intercourse. They have that
Yeah.
dryness, and it's really a big thing to them that, even if I don't open it, they just come and, approach me for these concerns. I'm
Mhm,
sure,
mhm.
Joseph, that's also what's happening with you, right?
Yes, yes. Because you mentioned a while ago with regards to your aesthetic aspect of O shot or even
Yes,
the very significant the G spot. We do in the male counterpart we call it T shot, right? T
yes,
shot.
yes.
Uh,
Yeah,
so so the rejuvenation and regeneration aspect, Mitzi, because Mitzi is in the younger generation, is
younger.
very significant for females who, especially for you, in the pre-menstrual, right? Or
Right.
premenopausal or
Right.
perimenopausal, you call that term
Yes.
stage, no? So why do you think are women, are you saying, are gearing more to the aesthetic side? Is it because especially during the pandemic, they are in a lockdown, or men are more not worrisome. Men are more
They're more stressed.
what do you call no not
Huh?
they tend to interact more, so they
Yes.
identify more, and they visualize more, and they tend to be cautious about the second phase of females, 'di ba?
Right.
Sometimes kasi, Jenny, they will say, oh, bakit naging ganito? Bakit
Right.
naging ganyan? O, 'di ba?
That's
Pero
true.
before, Mitzi, parang hindi mo naman
Mhm.
pinapansin because of, so ngayon
Mhm.
parang lahat pinapansin mo na. Oh,
I'm
Yes.
not
baka
sure if I'm
baka
understanding it right, yung pinopoint out ni Doc. Pero feeling
no,
ko tama.
what I'm saying, when I say the
Yes.
second phase na I mentioned, is the down, the
Yeah.
vagina na
Yeah.
minention. Oo. Kasi, di ba, sa lockdown, um, husband and wife couple, di ba? They
Yes.
see each other more. Also, say, they can do sexual
Yeah.
performance. So, pag ngayon, mas na, mas na visual, hindi naman visualize, you visualize, but you are more intense
They see.
in seeing physically, kasi araw-araw during the
Yeah.
2 years of lock,
Actually,
you are together, di ba?
yeah.
Okay,
Actually,
Jenny.
Joseph, this is what I get from the patients, no? They have more time to be intimate, right? And then at
Mm,
the same time, they said it's nice because they have more time to talk about their problem. And most of them,
mm,
I did not know that they have problems with intercourse. So, all these symptoms come out, and the couples talk about it, like dryness, irritation, pain during intercourse, and they
yes.
discuss, and at the same time they want to be treated, they want to have improvement in the quality of life. And that is the reason that they approach me for aesthetic gyne, and they also come and
Mm-mm,
see you. Right,
mm-mm,
Joseph, for
mm-mm,
for
mm-mm,
men. So I
mm-mm,
think it's one of the big factor that really helped them during pandemic, because they became more intimate, and they are
mm-mm, mm-mm,
actually more open to it, and they want themselves to be helped. And I think
mm-mm,
that is one good thing about pandemic, because the family life has really became the center of the house, right? It's not work anymore. It's different. Hmm.
mm-mm. Like when so that for Mitzi to understand, like for your
Yeah.
side, you talk about prevention of dryness and
Right,
improvement of collagen production, no? On
right.
our side, when you're talking about it, it is about not a transitory erection, like you take a pill, you pop a blue pill, and
Yeah.
that's it. You know why my patients now, Jenny, they want prolonged erection without
Yes,
Doc
needing the
Joseph, I'm
I
pill.
heard
sorry,
that
what's
from
blue
patients
pill?
too.
Sildenafil. Sildenafil.
Ah,
I
so this
cannot
is a
ano
pill that
the brand.
okay. Oh,
Oh,
okay.
for men to have
Gets up.
improved erection. We call it the blue pill.
Okay.
Okay, kasi
Yes.
it's from Pfizer. So,
Okay.
what they want is prolong, Jenny. They prolong the erection without taking
Right,
the pill. So
right,
it's the same with your like for you, the female counterpart. It We talk about regeneration and
right.
improvement and rejuvenation. Do you
True.
agree?
I agree. Yan yung yan yung mga hinahanap ngayon ng mga patients. Actually, there are like supplements. Joseph, you mentioned about the caviar, right?
Yeah,
Because
caviar.
I know, like, for instance, with the caviar reale, I think it's very good because it
It's
also
familiar.
sets the couple into the mood to have intercourse. So it's not like just
Yes.
having an erection and having an
Mm-mm.
orgasm and they have an intercourse. They enjoy each other at the same time. So there is also regeneration of tissues as well. So it's not
Mm-mm.
like only all these machines and the injectables that we give, but we also improve their well-being as well. Hmm.
All right. Correct. Correct. True. Mitzi.
Mm,
Yeah.
Si Mitzi kasi
okay.
baby
I'm
yan, dalaga.
curious.
Kaya naaano
Baby
siya,
ba?
naku-curious siya eh. Parang
Oo,
gano'n.
oo, oo, oo.
Oo.
Well, it's nice that we get to talk about this, most especially sa social media po, because we all know that this is a very taboo topic here in the Philippines, right? So bihira
Yeah.
lang siya mapag-usapan sa school, you know. I can still remember when we were talking about it in school. Syempre, it's ano po, it's a co-ed. So lahat kami naghihiyaan. Oh my gosh,
Oo.
what?
Oo.
You know,
Oo.
so it's a privilege that we get to know this and to also educate our viewers. So, for my question, Doc, in relation to my age, what are the things that I should be wary about? Like aside from the right washing, is there another type or care that I should do to my second face? I'm thinking of
Well,
naming it na nga eh.
well, actually, Mitzi, how old are you? May I ask? Are you in your
I
30s?
ano po, I'm 23. Oh my gosh,
Or
I'm
30s or
30.
20s? No, no, I'd like to ask kasi iba-iba eh. Di ba?
Yes
May
po.
30s,
Opo.
may
Oo.
20s, right? Okay, so what do you need to do? Of course, it's not only your second face that you need to take care, right?
Yeah.
So you have to check your breast, make sure that you know
Mm.
your breast, right? If let's say if you have a strong family history of the breast CA in the family, you have to be very cautious about that, and eventually you have to have like an ultrasound every year, okay? But I think what is best and very practical is that after your period, that is the best time for you to check your breast and be familiar. Check your period. Is it very regular? Is it sexually active? You can have your pap smear, right? And then, also have an ultrasound to check your uterus, your ovaries, and also have your vaccines, anti-cervical cancer vaccines. All these are actually very important. Everybody has to take care of their own bodies right
Yeah.
now because I think that is wealth for us right now. We really need to be very
True.
healthy in this time, right? Mhm.
True po.
Mm-mm.
Yeah.
Do
Right.
you include Jenny, like for young female like Mitzi, vaccines for wart? Because these are very common.
Yeah,
Oh
HPV
yeah, yung mga
vaccine.
Genital
HPV.
warts.
Yeah.
Yeah.
Actually, you don't just get warts by intercourse, you get it by fomites. And just imagine, let's say you go to a public toilet and you're still seated there and you use the flush. It can splash on you and you get warts because I've seen women
Oh
who are
my
not sexually
gosh.
active and then they have warts and they complain of all this
All
itchiness and they
right.
come.
Yeah.
Mhm.
Oh my
Yeah.
gosh.
So, pwede ka
Right.
na magsabi, Mitzi, pag sa public ka, ooh, dirty. I'll get wart.
Oh my gosh.
Yeah.
Parang kahit anong ano po, no? Kahit anong ingat po natin, lalo na kapag, when we do our business in the toilet, hindi natin mapipigilan na may splash, no?
That's
Naku-conscious
why,
tuloy ako.
if we can protect ourselves and get vaccinated for that, because that can lead to this HPV, can actually lead to cervical cancer also in the future. So, I
Mhm.
think what is important is for us to be very well informed about these things, right? So
Right,
that we
right,
can
right.
decide and help ourselves to be on our top health. Hmm.
Mm-mm-mm.
Yeah.
I have one question,
Yes,
Jenny, because this is a very interesting topic that you discussed.
Yeah.
And for our audience, especially for our female audience here and abroad, they might ask, is this essential? You talk about aesthetic. Is this essential, doctora? Di ba? Di ba?
Mm.
We're always asked about this. Like
yeah,
for me, for men that come for me, I always ask, I always tell them, what is your need? You know,
yeah,
why do you come to seek me? What is the need? Because there is a problem.
right.
Because your John doesn't want to talk to
Ganja.
you. And Jun, no? John, ginawa
June.
nating English.
Yeah.
Hindi, ayaw ka nang kausapin. Gusto na niyang
Mm.
mamatay. And for men, that is a pitfall, right, Jen? Like for
Yes,
females also, I think the what you call the second phase becomes very significant when their
yes,
partner or their husband per se starts to disappear in the night
that's
or
true.
something, or they are not being what do you call, what's the best term? Hindi na
They're not
pinapansin.
responsive. They're
They're
not
not
responsive,
Oh.
responsive. So
right?
how can you explain to them that this is somehow can
Very
be
important.
essential, right? Very
Okay.
important.
You know how it is essential? Would you believe that for me to study I studied aesthetic gynecology initially in Turkey. I took a workshop there, no?
Mm-hmm.
Now, studying aesthetic gynecology is actually very expensive. But this is how I decided that I'd like to go on to this training because, do you know, that patients are the ones who ask it from me. I'm okay to just be a urogynecologist, to be a robotic
Yes.
surgeon,
Yes.
but patients are the ones who ask it from me. And, I have limitation on what to offer. So I got very interested with innovation and, um, can I just brag about this? I've started
Yes.
July of
Yes, of course.
2016 of aesthetic gynecology, and I have helped 38 marriages as of now. I
Wow.
feel so good sharing this because I didn't
Right,
know
right,
initially that
right.
it's actually very important. But
Mm-mm,
then,
mm-mm.
it's not only helping them down there, not only aesthetically, but functionally, but also, I think it's very important because it kept their marriage, right?
Yeah.
It
The
becomes
relationship.
it becomes relevant. It becomes
Yes.
relevant, Jenny, with regards to the second phase or their vagina. You know, the husband tends to differentiate it now. Na, oh, it seems to be different. Agree?
Yes. Yes, I think a lot of women has benefited a lot from this. And what's so funny in the clinic right now? It's not only my patient whom I've treated, whom I receive presents. Would you believe I receive presents now from husbands of patients? So I guess
Wow.
everybody's happy, right? Yeah, but of course, I just don't treat aesthetically. What is very important to me also is the function. And
Yeah.
like what
Mm-mm,
my
mm-mm,
patients are
mm-mm.
saying, like when I do robotic surgery, I only have small incisions in the abdomen. So they're asking me,
Mm.
you make me pretty in the abdomen, so I know you can make me pretty down there.
Down there.
So, I've been getting all those, remarks from patients. So, okay, I'm going to study eventually. And it's actually a new field here in the Philippines that we are actually promoting. I'm actually the vice president of the Aesthetic Gyne Society of the Philippines, and we're teaching the OBGYN to be active on this part too, because we are the ones receiving these patients, right? And yeah, we would like to offer them to improve the quality of life. Hmm.
This is one thing that Mitzi, they always say that if I'm 50 or if I'm 60, if I'm menopausal, I will not be left out by my husband. Correct,
Yes, yes,
Jenny?
yeah.
Because look at my second phase. It's still as fantastic as my, you know, since the
Yes.
time that we got married, or you know me
Mhm.
because of this, right? And I think for men, they will encourage women
Yes,
who goes to this aesthetic aspect.
true, true. Very important. I think that's very important in the in taking care of your body as well. Mhm.
True. And Doc
Mitzi.
Jenny, if like, Doc Jenny, you mentioned earlier about robotics, and earlier in your credentials, you are the first surgeon in the Philippines to use robotics in women care. May I know exactly what procedure was that for?
Well, I do minimally invasive surgery, let's say for procedures like hysterectomy, removal of the uterus, myomectomy, removal of the fibroids, right? I do
Mhm.
suspensions like sacrophalcopexy. So anything that you do in an open surgery, you can actually do it in a robotic manner. That is minimally invasive, but we use machines, okay, to help us like a surgical tool to make it easy, safe for the patient. and it's like giving the best shot for the patient because they heal so fast. Like if you do the surgery now, in less than 12 hours they go home and they don't have
Mm-hmm.
any
Mm-hmm.
discomfort. The chances of blood transfusion is actually very minimal, and you can see that the procedure is very precise because it is three-dimensional. But
Yeah.
just to share with you, a lot of people are saying that when you do robotic surgery, it's the machine, the robot doing the surgery. No, the robot is only a surgical tool. It's still the surgeon who still does the surgery, but the procedure is very precise.
Mm,
Mm-hmm.
okay.
Yeah.
How can you
So,
Jenny, tell a offer female who wants their vagina to be moist or wet?
Yes.
Do you some would say that, oh, doctora, you just inject, or I'll just take oral collagen or
Uh-huh.
whatever, right? But you
Uh-huh.
have presented some machines
Yes.
for collagenation and rejuvenation. Do you prefer that from the conventional ones, like the
Yes.
orals or the inject?
Actually, I do prefer. Why? Because let's say if we're going to give the hormone estrogen, okay, even if you apply it in the vagina only, okay, it goes to your bloodstream. I've seen a lot of patients who develop breast masses and breast cysts, okay, with prolonged use of estrogen, okay. And with the use of lasers, what happens because of the heat, okay, it stimulates the collagen and elastin fibers to regenerate. Okay, new blood vessels are formed, new nerve fibers are formed as well. So, because of that, you can see that more glycogen are formed, and therefore the patient lubricates more and it becomes young, right? So, it's it's not only just applying cream because let's say you're just gonna put a cream that is not a hormone. Just imagine a table, a wooden table. You're just putting like mayonnaise on it. When you remove the mayonnaise, it's gone, right?
Mm-hmm.
So if you're gonna use hormone, the problem with the hormone, if you're gonna use it for prolonged use, you also have to check the breast because you can the the
Exactly,
the
exactly.
hormone will go into the bloodstream and it will actually influence the breast very much.
Yeah.
And I've seen cases who develop breast cysts and breast mass. Like for those
Mm-hmm.
patients who have like breast cancer, they become dry, very, very dry, and you cannot give hormones. But with the use of these
Mm-hmm.
lasers, this radio frequency, the erbium lasers, you can actually attain or achieve a good outcome, right? Even without giving any hormones. And the result is, even if you do it after 3 sessions, okay, even 6 months after that you're not doing this lasers, it regenerates on its
Mm-hmm.
own. That's why after
Mm-hmm.
6 months or after 1.5 to 2 years, you have to give one session as a memory dose so that it will be reminded again, okay, I will regenerate again.
mm-mm.
Right, right, right.
Mhm.
Yeah. So how,
Mm,
like the sessions are dependent on the need of the patient as per
Yes,
patient's need. You can come and have another sessions as you want, and depending on the results, right? Because some
yes,
patients would ask you, Mitzi, Doktora, okay na ba to? Pero
okay,
sometimes you feel that you need to have more, then you
yes.
advise your patient, right?
Yes, but most of the time, the protocol is 3 sessions, 1 month
Mm-hmm.
apart because the first session is actually the collagen that regenerates. On the
Mm-hmm.
second session, it's the elastin fibers. On the third
mm.
session, it's actually the combination of the two, and it will keep on regenerating and remodeling.
Right, right, right.
So we target one area first, and then on the third, on the latter sessions, it's the mix. It's
No,
the whole.
actually, it's like It's like having a transvaginal ultrasound. You put the probe in the vagina, okay, and then you apply the laser, and you repeat the session on the second month and on the third month.
Mm,
Mm-mm. That is for the
okay.
inner, but for the outer, of course, it's different. If you
Dif-
want like a rejuvenation of the vulvar tissues, then it's going to be a different probe.
Mm-hmm, mm-hmm, mm-hmm.
Okay.
Okay, Mitzi.
Um, since we talked about the vaccine earlier for the warts, for the cervical cancer, at what age, doc, can us ladies have the vaccine? Or any can you also share the vaccines that we can have?
Okay, we have the HPV vaccines, right? We have the Gardasil, and
Mm-hmm.
I think the Cervarix. But now I think the Gardasil 9 is the one that is available in our country right now because to last year we don't have the Gardasil 9. It was the Gardasil 4. But now it's good that we have the Gardasil 9 that covers more strains. Okay, we can
Mm-hmm.
start giving this vaccine, especially when these patients are actually starting to be sexually active already.
Ah, okay. So
Mhm.
regardless of the age, doc, basta they are already
Mhm.
sexually active.
If sexually active, it's good to give it already. But some would start at 9 to 11 years of age because in the US, they start early.
Mm-hmm.
So they give it early.
Oh,
Mhm.
yeah, because I remember back when I was in grade school or high school, they were offering a cervical cancer vaccination, and
Yeah.
um, I didn't have I didn't have it.
Mhm.
All right. So, okay. For our viewers, if you have a question for Doc Jenny, just you may just type them in our comment section, and we will give it to her, and she'll try to answer it. So, okay. Doc Joseph, are you okay? Parang okay. Yeah, I think Doc
Me?
Joseph fixing his phone. Okay.
Okay. Are you okay?
Ayan.
Okay. So what else?
Yeah.
Okay. It is the same thing as what we're on my side, right? There is you want prolong and improvement, not very short term as what Jenny is saying. No? I just want to ask Jenny with regards to the incontinence because we have a lot of SUI coming in, right? Especially sa female urology or the functional urology aspect, right? You know for the
Mhm.
fact, right? Like Vanny has been telling me about it. In your cases, in your
Yes.
case, just in case your patient have both incontinence and wants to have the aesthetic aspect, right?
Mhm.
How do you deal with the management? Do you deal with the
Mm,
incontinence first or the aesthetics? Because some women will like, Doktora, wag na lang yung incontinence ko, bayaan mo na siya. Yung aesthetic side ko na lang. How do you go
please,
about it?
ganda.
Or sabay na natin? Oo, di ba kasi, oo, ganun na.
Yeah.
Yeah, like
Yeah.
for me, Mitzi, when you talk about enlargement of the prostate, no, I'll go ahead in then
Mm-mm.
yung may ED, erectile dysfunction, sasabihin nila, Dok, bayaan mo na yung BPH ko, ED na lang ang i-treat mo. So is this the same thing that your female patients will ask you to do or you'll give them a different advice on it?
Yeah. Okay. This is what I do. You know, when I see the patient and they complain of incontinence, okay, I have to address first what kind of incontinence. Is it stress incontinence,
Mm-hmm.
urge incontinence, or mixed incontinence? If it's stress incontinence, when you cough, when you sneeze, and when you laugh, you leak urine. Okay? So, what I do, I check them and I check what is the reason. Is it because of urethral hypermobility? Or
Mm-hmm.
is it because of urogenital atrophy that the I've shown you earlier the opening of the urethra becomes thinned out as we age,
Mm-hmm.
okay? Usually, if it's just because of urethral hypermobility, I do not offer lasers. Okay? But if it's because of the dryness or the urogenital atrophy when the tissues have thinned out, I offer lasers because the laser, we actually strengthen the vaginal tissues, right? And also what I have in my practice, I also have the urethral probe. Okay, I'm actually very lucky because I was given the opportunity that they sold it to me. So I also have that urethral probe that I put in the urethra to stimulate regeneration of the collagen tissues in the urethra. That's why
Wow.
I operate for incontinence. But if you're just going to rely on the vaginal probe for stress urinary incontinence, probably it would help, but only for a few months, let's say 3 months, and then after, of course, the tissues would age, and then you're going to have incontinence again. So what I'm saying is, I think the proper assessment is necessary because if the incontinence is because of urethral hypermobility, then it's still best to offer the sling, right? Like a
Mm-hmm.
EVP sling, or you can do a
Mm.
birch procedure. But let's
Yeah,
say your
birch.
incontinence is urge incontinence, like when you cannot make it to the washroom, you leak before getting there, then I start them with anticholinergic medications, and
Mm-hmm.
they improve in time. But then I make sure
Mm-hmm.
that they know the proper Kegels exercise. If they cannot do that, I
Right.
offer them biofeedback, because remember, for you to maintain continence, it's not only the pipe that is the problem. The problem is also the pelvic floor. So we have
Mm-hmm.
to
Mm-hmm.
strengthen the pelvic floor as well, because there's so many trauma in it. Birth trauma, number two, aging as well. So it weakens. That's why I have the biofeedback machine, which helps them contract the pelvic floor muscles. And at the same time, if that doesn't work for them, I make them sit in the electromagnetic chair, which really improves the tone of the pelvic floor, which helps them
Mm-hmm.
to maintain continence. I still do the
Yeah.
surgery, but I really choose the
Mm.
patients. If it's mild lang, they're okay already with the rejuvenation, because the tissues are actually addressed.
Mm-hmm.
Mm-hmm.
One more before I
Mm.
give it to Mitzi. Can you tell our audience or our viewers online, because you kept on mentioning Kegels now, for what is Kegels? Baka sabi nila, ay, Kegel, parang giggling or ano ba gagawin yan? So, how is the proper way to do Kegels exercise?
Okay. Now that we're all seated, okay, this is what you do. If you can do this
Okay.
properly, then you are contracting the right pelvic floor muscles. Yeah,
Okay,
Mitzi,
I'll
Mitzi.
try.
ha? Tell me if you're doing it right. Try to pull your vagina up into your tonsils
How?
without contracting the legs of your thighs. I know it's very difficult, right? Because when I teach this to patients, I make sure that my examining finger is in the vagina to
Oh
make
my
sure
gosh.
that
Wow.
we are contracting the right
Okay.
muscles. Can you do it?
I'm
Try
not
to
sure, Doc.
pull. You see, that's the problem, eh. The basic kasi, okay, you improve your Kegels, but if you cannot do Kegels exercise, how do I know if that you're doing it right? Just imagine the elderly
Correct.
population. How can you make
Mhm.
them do Kegels? They cannot even understand. If I tell them to pull your vagina up to your tonsils, they cannot do it, right? Just a very few, maybe you can count in my one hand.
Doc,
So,
sometimes it
Correct.
contracts. I'm not sure if that's Kegel. Sometimes it goes up and sometimes it goes down.
yeah, but what is it, diba? It has to be the right muscles being pulled up,
Right.
Yeah.
right?
Okay.
Mm-hmm.
And I guess
Yeah.
this is
Mhm.
important, most especially for those who are pregnant. They have to
After
practice it.
childbirth, I
Ah,
think they have to have a pelvic floor rehabilitation to
oh,
strengthen, because, like, in our country, it's not the it's not what do you call that, hard and fast rule yet, but
yeah.
like
Mhm.
in Paris, in France, no, I've been getting patients in the clinic that after giving birth vaginally, they look for me to have the biofeedback treatment or the electromagnetic chair, because it's mandatory for them to address their pelvic floor muscles right away after delivery.
Exactly. Mhm. Mhm.
Uh-huh. So I think it's very
Mhm.
Okay.
important. Mm-hmm.
Okay.
Because once it's lax, if you don't treat it right,
Yeah,
Jenny,
yeah.
it might remain lax forever.
Oh my.
True, true. Mm-hmm. It
Oh
will be
my
lax
Mitzi. Oh,
forever,
sige. Go.
no? Yeah.
Ay. Okay.
Okay.
Siguro last question, Doc, maybe. Baka may baka may madagdag pa si Doc after this. But you were mentioning incontinence earlier, Doc, wherein
Right.
hindi po napipigilan yung urine na lumabas, no? Because sometimes is it how often po yun dapat mangyari for us to say that it is incontinence already?
Okay. Well, the definition of incontinence is when you cough, when you sneeze, when you laugh, when you strain, you leak urine. You should not have a leaky pipe, you know. So what I'm saying, you should not be leaking at all. But
Mm.
it is not. It's like saying that it is common as we grow old, but it is not normal. It is just
Oh my
common.
gosh.
That's why it has to be addressed and it has to be prevented as early as possible. That's why if we know how to do the proper Kegels exercise, that would help, right?
I'll practice that na rin po.
Ako
So to
for ano,
avoid.
for last kay Jenny before we let Jenny go. Ako for ano women that is
Uh-huh.
listening to you, 'di ba? So yung a bit of advice kasi sometimes they will say, "Ay nako, ayaw ko pumunta kay doktora, papaganda, wag na. Okay na 'yan, you know.
Mm-hmm.
I'm okay with that. Masyado ka namang OA. If there's a if there's a woman talking to another woman but the other woman wants to have it fixed, what is your advice for women who are hesitant and who are not willing, but they tend to have
Mm,
problems and they just mumble and brag about it?
Okay.
At the end of the day, do you think
Yes.
this is the time that they need to seek your specialty and
Mm-hmm.
help?
Okay. Yeah. Well, you see, when I see patients in the clinic, I offer them all these machines. Okay.
Mm.
Remember, my first approach to them is not to treat aesthetically, but functionally. The aesthetic part is actually a bonus for them, right? And then I tell them, if I'm just going to give you medication, you're going to be taking medication for life. Because, these medications, when you take the medication, when you stop taking the medication, you're going to be leaking again, right? So I think what is important is we have to go to the root cause. So, what is the root cause? Those are actually the problems of urogenital atrophy. Remember, I showed you the slide
yeah.
earlier. Everybody will
Mm-hmm.
undergo urogenital atrophy. So I think I actually educate them that this is actually going to happen and you are already symptomatic right now. So if you're having incontinence, you're having dryness, dyspareunia, pain during intercourse right now, even if I give you medication, that medication is only for the time being. And then after that, they're going to get it again. So we'll never solve the problem. So we have to go to the root
Right.
cause. Mm-hmm.
Exactly. Wow.
Yeah.
Thank you, Jenny, for
You're
those
most welcome.
wonderful answers, and of course, a very interesting and fantastic lecture. Mitzi, you have something for Jenny?
Thank you.
Yes. Yes, of course.
Surprise! The
We have
surprise.
yeah. So, Doc Jenny, like we always say to our guest, we appreciate your presence and your
Thank
time, of
you.
course, on our episode. So, in
Mm-hmm.
return, we would like to present you the Sunday Health Show's virtual certificate of
Oh,
appreciation as a token
wow
of
naman may
gratitude.
ganyan pa. Thank you
O,
so
di ba?
much.
O,
Yes,
saan ka
opo.
Grabe
nakakita?
naman bongga yan. Thank you.
Ayan.
Thank you.
So, okay. Uh,
Pakita mo.
Let me read to you the certificate.
Citation.
All
Mm-hmm.
right. So, ayan. The certificate of appreciation is awarded to Dr. Jennifer Marie B. Jose in recognition of her commitment to health, for sharing her valuable knowledge and time as the episode guest on Aging of the Second Phase, Women's Aging Health Reproductive Health, explained on Sunday, November 14, 2021. Signed by yours truly, Director Mitzie Aguinaldo, our producers, Dr. Joseph Lee, and of course, Mr. Pocholo de Leon Gonzalez.
Thank you very much. I enjoyed
Yay!
too.
We're glad po,
Nagulat
Doc. We're
ka?
glad.
Oo, di ba? Online health show may certification.
Thank
All
you.
right.
Thank you, Jen.
Thank you very much too. I had fun too.
All
Thank
right.
you, of course.
Thank you
Hope
po.
to see you
So,
soon.
Yeah, see you
yes.
soon.
Mitzi. Mm-mm.
Doc, where can we reach you po pala if you want
Yeah.
to have a
Your
consultation? I
clinics.
remember there's a comment earlier. Sige po, where can we reach you, Doc?
Well, I'm holding clinic in Makati Medical Center and also St. Luke's Global City, and also my machines are at Medical Plaza Makati. But I
Mm-hmm.
think what is best, because I really go see patients by appointment, and it's really best if I see you face to face. You can
Yeah,
actually
yeah.
call my secretary to make an appointment. Her name is Lisa.
Mm-hmm.
0922 824 3266.
Oh,
I'll
there.
repeat, 0922
There.
825 3266.
Yeah, it's flashed in
Okay.
the screen already.
Okay.
So lahat ng
So,
nakikinig, mag-appointment na. Now na. Queue na.
yeah.
Thank you.
Okay. So, I hope our
You accept,
viewers.
oo, di ba, Mitzi? Do you accept, Jenny, like calls or consultation from abroad? Di ba, Mitzi, if we have
Ah,
Yes,
opo.
chat
like a
chat
telecon, like
box or
that.
call, no, yeah,
Yes,
they
I've
can
been
seek
receiving.
your advice, right? Mm-mm.
Yes, po.
Okay.
Mm-mm.
Oh, okay. So for those who are curious, aside from an OB/GYNE in the hospitals, we actually also have a urogynecologist. So we hope you listen carefully earlier, and if you have the chance, try to have a checkup now with a urogynecologist like Doc
Like Dr.
Jenny.
Jenny.
Right.
Thank
Okay.
you.
So
Thank you,
yes,
Jen.
Thank you. It
thank you,
was
Doc
fun.
Jenny.
Thank you. As
Thank you
I hope
so
you had
always.
much
fun.
po.
Huh?
Okay, so late ata dumating. Thank you, Doc. We're very
Thank you
grateful
also.
po.
Thank
Yan.
you.
So, okay guys, wag po bibitiw. At heto na po ang last ganap, ang What's Your Baon for today.
Ayan, good. Okay.
Okay. Hello.
Hello,
Hello, Gia.
hello.
Ayan na si
Hello.
Jihan, nawala na si Freddie.
Nasaan si
Yes.
Fred? Ayan,
Ayan na
There.
nandito
Freddie.
na.
Oh,
Ayan.
yeah. Oh,
Hello.
ano masasabi ninyo? Si Jihan muna. Oo.
Yes, una sa flow, gumagamit ako ng flow and malaking tulong siya sa akin. And dun sa
Mhm.
sinabi ni Doktora, dun sa incompetence,
Continents,
like,
continents.
sorry,
Incontinence.
incontinence, it's common but it's not normal. So,
Yeah.
if you're experiencing that, you better consult the doctor para at least magawa ng paraan kasi sabi niya your pipes should not be leaking, right?
Yeah. Opo.
Yeah. Sir
Okay.
Freddie?
Yes, ayan. Magandang umaga po ulit sa inyong lahat. Talagang from beginning to the end, marami tayong natutunan. Alam niyo, Doc, Mitzi and Jihan, at sa mga nanonood, perfect na perfect ko po ang Kegels exercise. You know why?
Wow! Wow!
Yes, kasi mula pagkabata ko po kasi I always
Hirap
go
nga
to
si
the
Mitzi.
bathroom. Yes,
Ano
Hindi
na?
ko alam kung tama.
yeah, once
Megamitsy.
yes, once in an hour ako po ay nasa CR. normal ko na po yun. Kasi almost meron po akong tubig palagi sa tabi ko. So, palagi pa akong umiiyak mula pagkabata ko niyan. Hindi naman po yun sakit, but accordingly, yun nga, you have to exercise, you have to do the Kegels exercise. Kaya, I'm sure I was 12 years old when I started this Kegels exercise na sinabi ng doktor din sa akin at that time. And yun nga, till now, yun, ganun pa rin at malusog pa rin naman hanggang ngayon. So sa mga kababaihan, just learn how to do your exercises. Kung mayroong beautification sa mukha natin sa harapan, meron din under or doon sa pinaka-importanting face na pagkatago-tago. So kung may collagen sa mukha, may keratin sa mukha, may RF sa taas, mayroon din sa baba. Mas kumpleto dapat para ang maintenance ng beauty is forever and ever. Diba?
Pretty fire,
Salamat po.
Gigi.
Salamat po.
Ay, nako.
Ay, nako.
Yung,
Ako na ba?
sige, sige, Doc.
Hindi, may sasabihin ka. Sige, go ahead.
Sige po. Kanina yung tanong ni Doc, yung ang tawag doon, yung ano ba yung uunahin, yung sakit ba muna or yung pagpapaganda? Alam, sobrang uso yan sa atin, no? Inuuna natin yung pagpapaganda kaysa maggamot yung
Totoo yan. Totoo yan.
Ay, nako.
Ako, I have
Sana
the same
mabago
sentiment
yun.
as kay Doktora Jenny,
Jenny.
no? They always use like for men, sabi, ay, ED yung correct mo, Doc, saka na yung prostate ko. Talaga, ko-correct ko yung prostate mo muna. Ayaw nila, pero ganun. Pero anyway, yung baka we do Kegel exercise for incontinence, no? Baka ma-confuse yung ating si Mitzie. Ay, Kegel exercise si Freddie. We do that for incontinence, especially for overactive bladder. You can do Kegel exercise for both men and women, no? But women kasi they tend to do it sabi nila more properly, di ba, Freddie, as in men.
Yes.
Kasi siguro si Freddie na niya na yung art of doing the Kegel exercise properly and appropriate. Saka yung spelling Kegel tama?
Yes.
Oo,
Yes,
Kegel's exercise. So, ang akin naman is like what you do with your body is yours to take, no? Walang pakialamanan yan pag gusto mo yung aesthetic. Ako ganun, Jihan. Ako lagi ko sinasabi, bakit mo papakialaman siya? Bakit mo siya ibabash or because she wanted it for some reason or another, 'di ba? For her partner or whatever, 'di ba? Yung para improvement. So let's give it to the person who wants aesthetic. Now with regards to functional, I think you need to have it corrected, no? And go to a specialist talaga. When you say functional, yung incontinence, yung prolapse, your bladder prolapse, your uterine prolapse, yung ganon. So, kailangan doktor or specialista ang punta. Wag lang sino-sino dyan na may mangyari sa'yo. Yung, lalo na yung mga lagay-lagay ng cream. Nako, di ba? Freddie, Jihan,
Yes.
mag-ingat. Nako. Yung mga linalagay nyo dyan. Di ba?
Yung mga wash, Doc. Yung mga wash, mga ginagamit.
Ayun na nga, sinabi, di ba? So, you don't acidify it too much and you don't make it into basic because you'll get fungal infection. I always tell that to my female patients that wag masyadong malinis. Kailan may konting dumi din.
Yeah, you let we let the normal flora clean itself.
Right.
Ganon.
Yes,
Exactly. Okay, Mitzie.
Yeah.
Before you say something,
Yes,
did
Doc.
you know, alam nyo ba? Oo, alam nyo ba, Jihan, Freddie? Kala mo ikaw lang nag-research Alam nyo ba, November 21 ay birthday ni Mitzie?
Happy birthday, Mitzie!
21?
Ba? Naglaga na ito.
Di ba, 21? 21 ba birthday mo?
September ako, Doc.
September ka
2.
ba?
September 2 po.
Sinong Mitzie yun?
Baka ibang Mitzie yun.
Nako, mali ang aking source. Lagot
Ayan,
ito,
Doc.
mamya sa akin.
Ako may sabihin din ako,
Nako.
Doc.
Ano yun, Sir Freddie? Ay! Oh my gosh, yes, Sir Freddie, go.
Yes,
Oo.
today is my wife's birthday.
Wow,
Happy
happy
48th
birthday.
birthday. Yes.
Happy
Happy
birthday po.
birthday.
Happy
Yan. Sa
birthday.
23 din po, birthday ko rin po sa 23.
Ayan,
Ay,
Doc.
Okay,
Yan.
happy
Sir Freddie,
birthday.
ayan.
20.
Oh,
Ayan,
Yes,
mas
no,
happy
malapit. Ay,
23.
birthday.
naku,
happy
mali ang
birthday.
source ko. Naku, Mitzi.
Okay lang, Doc.
September,
Ayan.
oh. Ay,
Opo,
thank you ulit.
September. Ayan.
Ayan.
So,
Talaga
again,
sinulat talaga, oh.
before we end our show, we are greeting Doc Joseph, ang aming nag-iisa na Dr. Joseph Lee ng happy birthday. The Sunday
Thank
Health
you.
Show wishes you well and wishes you more successes in life, Doc. We're here to support you, Doc, in all of your
Oo
endeavors.
naman, hindi. Sa atin ito lahat. This is a teamwork and lagi ko sinasabi with vision for more improvement and what? And awards, di ba? Uy, sabi ni Doktora
Yes.
Jenny, thank you daw. She enjoyed.
Yan. Okay.
Okay.
Alright.
Thank you. Thank you sa video nyo. Tapos, thank you sa mga research ng greeting. Thank you sa pinasalita niyo yung mom ko, sa brother ko. Grabe kayo. And of course, I love you all. No? Okay?
Okay. So now, takeaways na po tayo. Ay, takeaways. Ito, mga promotion now. So, yan. Maraming salamat po mga ka-Sunday Health dahil every other Sundays nga po ang ating episodes. Magkita-kita tayo po ulit this November 28th. So, again, every
Yes.
other Sundays. Sorry. Go ahead, Jihan.
Go ahead. Go ahead.
So, let's share now our social media. Simulan po natin kay Doc Joseph.
Ako, ano ba si-share ko? FB page, Dr. Joseph T. Urologist. Sige na, mag-subscribe nyo. Malapit na mag-6,000. Isa na lang.
Saan, Doc?
Then,
Instagram.
Instagram.
Subscribe for Road to
Instagram.
6,000 for Dr.
Yes.
Joseph Lee.
Yes.
And my Instagram, Dr. Joseph Lee. Yun lang.
Alright. Okay. Okay, yes. Okay, thank you po. Ako po naman si Mitzie Aguinaldo, naglilingkod. Social media ko po, Instagram, Facebook page, YouTube channel, TikTok, and Kumu. And of course, before I forget, thank you po sa lahat ng friends po ni Doc na pumayag at nag-send po ng videos. Lalo na kay Sir Joey Gamboa, ang video editor ni Doc Joseph. Isa po siya sa nag-suggest ng mga isasama po. And
Si
of course,
Jojo.
sa family.
My God.
Opo, yes, Doc.
Oo.
Isa pa yun. From from Illinois. Grabe.
Illinois.
And,
Oh my gosh.
kay Sir Jerome Lee, ang brother po ni Doc Joseph, thank you
Yeah.
for making a video. Kahit na sabi niya shy daw. Sabi ko, kahit unti lang po.
Grabe kayo.
Yun.
Oo.
Thank you po. Maraming salamat po. Okay. Sige. Next po pala si Ate Jihan.
Yes. Ako si Jihan and my Facebook and YouTube is Adovox. And happy birthday, Doc Lee, and advance happy birthday, Sir Freddie, and happy birthday to your wife also. And thank you to Kit at Kit and Company for her handmade soaps. And yun lang, Sir Freddie, it's your turn.
Yes. Sana ba ako yun? Muli, magandang hapon, magandang umaga po sa inyong lahat. Hapon na ba?
Yes,
Morning po
hapon
sa
na.
Kuwait, hapon na po pala yan. Medyo nalilito pa rin po ang inyong lingkod. Maraming salamat at kung gusto niyo po akong makita sa YouTube, sa Instagram, sa Facebook, pakihanap niyo lang po The Mellow Voice. Yan, maraming salamat po. Happy birthday po ulit, Doc. And to my family, yan, nanonood ang aking junior. Happy
Hi,
birthday
Gar.
for your mom. Yes, yun po.
Hello,
Thank you very
Gar.
much. Thank you.
Alright?
Yan.
Bago matapos ang lahat, binabati po rin po namin ng maraming salamat ang aming mga sponsors. This program was brought to you by Eric Lee Natural Spring Water, Gensis Organic Spirulina, Salvi Care Coffee,
Trident Gold, Emergency Rapid Assistance Application, and Asian Hyperbaric Healthcare Institute. Thank you for believing in our show.
Yes, and okay, bago po tayo mag-last but not the least, may bumabati po sa comment section. We have Miss Rowena Tino. Happy birthday to your wife and you, Sir Freddie Hermosa, and of course kay Doc Joseph Dow. And
Thank
at
you.
Jihan, may next pa?
Yes,
Si Eric,
from
Doc Eric,
Francisco. Happy birthday, Doc Lodi. Hi to Sunday Health Show.
Hi, Doc.
Nanonood si Doc Eric.
Ayan.
Ayan.
Sa wife ko ata ito.
Diba? May greeting ka, Freddie, kay Doc
Yes,
Eric.
thank you in advance, Doctor. Thank you po. Best regards to Kuwait workers. We're happy to serve po. Thank you, Doc.
Alright. Okay, and may pahabol from Ms. Liza Kaz. Congrats, Doc Jen. Okay, so last but not the least po everyone, shout out po sa Certified Voice Artist Program, ang aming pinanggalingan po, kay Voice Master Mr. Pocholo de Leon Gonzalez. Actually, Doc, siya po ang nag-message na gumawa ng video. Yan. So, yan. Ayan.
Siya ang promotor.
Kala ko
Yes.
kakanta ka eh.
Isasend ko na ba, Doc? Doc.
Ano pang sisend mo? Meron talaga?
Meron, Doc. Told you.
Another surprise.
Baka
Last na
atakehin
yun.
ako. Meron
Grabe.
pa.
Opo, Doc. Isasend ko sa'yo. Yun.
Sisend mo, hindi dito papakita.
Cover kasi yung Doc. Mahaba. Kahiya.
Ay, sige.
Ayun. So, okay. Next po, yung station manager, si Sir Richard Abalos. And of course,
Yeah,
sa
Sir
home station.
Rich.
Obo.
Jello.
And congratulations pala kay Sir Rich kasi first time na nag-air po sila sa DWIZ.
DWIZ.
Opo.
Yes.
Congratulations.
Congratulations.
Yeah. That's a win
Ano
para
pamagat
sa
ng ano
radio.
nila? Ano pamagat?
Love
Mitzie, ng ano nila?
lines. Love lines.
Love lines? Love lines?
Yes. Opo.
Ah.
Ayan. So, maraming
Advisor
salamat
na pala siya
po.
ng puso, ah.
Yun talaga yung ano ni Sir. Mga
Area niya.
hugot. Opo.
Hugot.
Ayan.
Hugot
So,
pa
see you
more,
guys.
ganon?
Opo. Ayan. Okay. Alright, it's 2:00 p.m.
Overtime.
Alright. So, sabay-sabay po tayo. Okay. And this has been the Sunday
That's Sunday Health
This
Show.
Health Show.
Health
Thank
show.
you. Thank you,
Thank you,
guys.
guys. Thank
Happy
you, Freddie.
birthday, Doc
Thank you,
Joseph,
Jihan.
again.
Thank you
Happy
po.
birthday.
Thank you,
Happy
Mitzie.
birthday.
Sige, send mo na, ha?
The day is here. The time is now. Meta Voices. The Meta Voices Talent and Casting Agency.
The day is here. The time is now. Meta Voices Talent and Casting Agency is here to bridge the gap between a variety of clients and the most empowered and talented artists of voices from the Philippines to the world and vice versa.
Your one source of multi-talented voice artists with professional voiceover experiences for various forms of media in English, in Filipino, and in any of the Philippines' 120 languages. Voice artists who are also
professional hosts online and in live events, streamers, singers, dubbers, and many more, all within one source.
the Meta Voices Talent and Casting Agency.
Our voices, your choices. Talk to our official voice caster or visit www.metavoices.agency today.
The day is here. Meta Voices. The time is now. Meta Voices.